guys waiting. I think I'm going to start and welcome all of you to our webinar tonight. I think Dr. Kavanagh just arrived. We have to help him to get settled. Exciting to see all of you here. As founder of MaskTogetherAmerica, I welcome all of you to our webinar series featuring scientists, scholars, medical professionals, and advocates who care about us. So who are we? MaskTogetherAmerica is a community who is dedicated to learn from this pandemic that has taken millions of lives and left millions disabled. Scientists are working hard to study and confirm the causes of disability. Science studies take a very long time. People are catching COVID every day and people are dying from it every day. My name is Julie Lam. I initiated this awareness project in 2020 after losing a friend who was a surgeon at a hospital who served the hardest hit area in New York. I went to the street with my camera, even when it was snowing or raining everywhere. I tried to look for volunteers. Behind me, you can see a collage of all these pictures I've taken, and today thousands of people have volunteered for this grassroots awareness project. As an artist and a writer, I'm proud of being a messenger. Everyone has a story to share. Public health awareness should be grounded in authenticity. Experts who study infectious diseases and infection control have knowledge to share if we ask them. That's what we do as a team. We are on a mission to give the floor to experts who can help us learn so we can help spread the word. I believe awareness saves lives. No one wants to be forced to get vaccinated, forced to wear a mask or isolate, but if they learn the true causes of death and long COVID, which can be all kinds of chronic illnesses due to viral persistence, autoimmunity, or reactivation of other viruses inside our bodies, then most likely people would take action to keep themselves and their loved ones safe. To start our event tonight, we are honored to have Dr. Kevin Kavanagh, an expert in infection control, to help us measure the risk in seeking health care when we are having respiratory viral activities in high levels. Christina Auriana is our MC for this webinar. Christina is an actress, screenwriter, and filmmaker who joined us in March 2023. Christina wears her mask even when she works out in a public gym to prevent airborne infection. She has been raising awareness on social media about COVID and the need for better ventilation, indoor air quality regulations, and using masks to filter the dirty air since the start of the pandemic. Without further ado, I will pass the mic on so she can introduce our guest speaker.
Hi, everyone. So Dr. Kevin Kavanagh, MD, MS, is a board chairman of HealthWatch USA, a nonprofit organization founded almost 20 years ago, whose mission is to advocate for high quality, affordable healthcare and high quality research. During the COVID-19 pandemic, HealthWatch USA has focused on patient and worker safety. The organization has conducted 4 webinars regarding COVID and long COVID, each of which offered continuing education credits for doctors, nurses, and allied health professionals. Dr. Kavanagh has written over 200 articles on COVID-19 and long COVID, 4 of which were published in peer-reviewed literature and in Infection Control Today, the Courier Journal, and USA Today. The organization was one of the first to call for a booster prior to the Delta wave, along with early on publicizing the multi-system impact of COVID-19. Thank you so much for joining us this evening, Dr. Kavanagh. So let's get started with our first question of the night. So What would you say to patients who are skipping preventative care or avoiding surgeries due to fear of hospital-acquired infections?
Probably not a good idea. I mean, you need to continue on getting your medical care. You need to do it as safe as possible. So you're going to need to gauge your risks, do planning ahead of time, and make sure that you decrease your exposure to the virus as much as possible. And I can go into a little later on ways of doing that if that's okay.
Okay, that's a great answer. Thank you. So, second question. Does one-way masking provide the protection a high-risk patient would need in a medical setting?
No, it does not. I think that that's a huge misconception. You've looked at personal health, which has become very popular in the United States, and that is not a substitute for public health where everybody participates. There's a good table that is put out by the Rockefeller Foundation, which takes a look at the relative effectiveness of different types of masks and one-way versus two-way masking. And basically, an N95 mask is much more effective than a cloth mask, 5 times as effective as not doing anything. Now, if you have a fitted mask, that's even twice as effective as an N95 that, for example, I would get off the shelf. But when you look at two-way masking, in other words, when everybody is masking, you now have 5 to 10 times the protection. Because here the mask is controlling at the source, which is so important because it will interact with every virus that comes out of that person. Unfortunately, you can still contract COVID-19 through your eyes. There was a good article in The Lancet which compared masking, wearing eye protection, etc. And there was about equal efficacy to masking and eye protection, meaning that eye protection still works. And if you don't have proper eye protection, which is hard to do with an aerosolized virus because you're not looking at splashes, but you're looking at particles floating in from the sides, you're still going to be susceptible. And that's why your protection drops precipitously with one-way masking. That's also why you need to look at dosage and you need to take other mitigation steps to keep you safe.
Excellent. Okay. So now, how should patients best manage the risk of COVID infection while seeking healthcare?
Well, it's going to depend upon the type of visit. I divide visits up into 3 types. One is a routine visit that is not urgent and it can be scheduled months out. The other is a visit which is of a new problem that's going to be scheduled maybe a few weeks out. And of course, then you have emergency room visits. So not all of these strategies work in all settings, but certainly you can call ahead to make sure that staff and the physician will wear a mask. You can call ahead to see whether or not you can wait in the car and then be called in to see the doctor visit. And this is important, for example, in the ER. You don't want to get stuck in the ER for 12 hours waiting to see a physician with everybody around you coughing and sputtering, because most likely they'll be giving out surgical masks to patients, which won't be very effective. Now, if it's for example, a visit that is out some time, you can do other strategies. For example, if it's months out, I always try to get a visit that's the first one or first 2 or second in the morning, where you can just go in and get seen, or get one in the afternoon. And that kind of alleviates the strategy of, asking to wait in your car. There you just go in and be seen. And of course, you want to complete your paperwork online. That's very important because you want to spend the least amount of time in that office as possible. Again, that goes with dosage. Now, let's say you're having a major procedure, such as a colonoscopy or a hernia repair that you can schedule. Now, two things that I would do. One is I would schedule it in May or June when rates tend to be a little bit less than in the other periods of the year. Granted, it's still high. You still have to take precautions, but that's the one time when COVID-19 tends not to be as high as in the summer or in the winter times. And finally, if it's a major surgery like I had, you can try to schedule your booster 2 weeks before. So you have optimal immunity, you have decrease in community rates, so your exposure is going to be less. You're wearing a N95 mask, and that's going to increase your chances of getting through a procedure. Now, doctor visits, you can kind of do the same thing. Call ahead of time, see if the staff will wear a mask. I one time had an eye appointment that an optometrist wouldn't want to wear a mask. Actually, it was an ophthalmologist. He refused to wear a mask. He said, "No, I'm not wearing a mask." I canceled the appointment. It was for refraction of my eyes. I got it with someone who would. I mean, goodness, during an eye exam, he's 6 inches away from your face for an extended period of time. It was ridiculous. It wasn't worth the risk. So all of that, I think, can be done to try to really look at how to maintain the lowest possible risk. And again, you're always going to have some risk in today's environment, but dosage is important on getting this virus. You want to keep the dosage as low as possible that you're exposed to, which means least amount of people. You wear mitigating, or you wear an N95 mask, implement mitigating strategies, and go from there. Now, the other thing I didn't mention was use of a CO2 monitor. And I think that those are very important. I use an RNet4, and that monitor you can carry with you. You can go into settings and determine what the airflow is, or not what the airflow is, but what the CO2 level is, which is a surrogate for good airflow. And if it is below 700, your chances of getting COVID or acquiring an infection are less than, for example, if it's 2,000, which is much higher. And if it's 2,000, I would spend the least amount of time possible in that situation. If you have to wait someplace, I would try to wait under a vent where the air is blowing down upon you and away, and certainly stay away from the air intake valve, or air intake vent of the HVAC system, because that's going to have the opposite effect. And if it's very high, I would think the next time you would go back, you might want to consider either talking to the physician about that, or seeking another area to or another provider. And again, you can have high CO2 levels if you have good filtration, upper room UVC lighting, et cetera. That's why I said I would talk to the physician about it. But very few settings right now have those extra strategies. So a CO2 monitor, I think, is very helpful. Sorry about the long and extended answer. That was longer than 90 seconds.
It was a great answer, though. It was full of wonderful tips and strategies, so please do not apologize. So this brings me to our next question. So the US is ranked 175th in the world for access to healthcare due to lack of universal healthcare coverage and high out-of-pocket healthcare costs. Does that contribute to the tremendous death toll and mass disablement due to long COVID?
Well, it certainly does. Access to healthcare is important. It's important you have access to both vaccines, and also access to Paxlovid, which is an antiviral. However, right now, the major problem is not so much people not being able to access, but people not wanting to access. They're not really taking Paxlovid. Very few are getting boosted. The current booster for adults, I believe, is only about 20% of adults have gotten the updated booster. Only approximately 11% of children have gotten the updated booster. And new data from the CDC shows that this is over 50% effective in the prevention of symptomatic COVID at 52 days out. From 52 days out from the vaccination. Now, that's not, a great statistic. You'd like to see it 2 years out, but it provides you some protection, especially if you're thinking about visiting relatives or you're thinking about having a major procedure. It's something to do, and people aren't doing any of it. So it's very, very frustrating. Paxlovid is, again, it's another problem that people aren't affording themselves of that. And so we're seeing the long COVID being a huge problem in the United States, and one which may actually exert a great toll on our society and the economy.
Yes, that's a lot. That's a lot to take in. But it's all right. So for our next question, former COVID response task force person, Dr. Ashish Jha, said recently in Time magazine that almost all of the US population has some immunity as a result of previous infections or vaccinations. Is it possible to achieve herd immunity from COVID-19? And why is this stance dangerous for public health messaging?
Well, it's, somewhat true. We do have somewhat of an immune response, but it is absolutely impossible to achieve herd immunity with a virus that is constantly mutating and immunity that's constantly waning. So, our immunity is predicated on either becoming repeatedly boosted every 4 or 5 months or becoming repeatedly infected. Neither one is I think, sustainable. I myself get boosted as much as I can, but the general population isn't going to get a vaccine every 4 to 5 months. In fact, at this point, they're not getting measles vaccines or other vaccines that are desperately needed, and we're seeing now outbreaks of other diseases. So I think that although the statement is true, I think that it needs better messaging. It's not stressing that immunity wanes, and it's also not looking at the ravages of long COVID. Too many people think if, you're out of the hospital, not hospitalized, mild disease, you're fine. You'll recover, nothing to worry about. Well, that's not the case.
All excellent feedback. Now, what does the US need to change in order to prevent a deadly wave?
Well, the US needs to change a lot of things. Number one is going to be ventilation. Number two is going to be acceptance of wearing masks and crowded indoor spaces, and also to start wearing N95 masks. The not wearing of N95 masks is a very, very concerning occurrence because, one, it doesn't provide the wearer with the protection that I won't say need, but it won't provide them with optimal protection. They probably need more protection than, as we stated, just them wearing N95 masks, but it provides them with the best protection possible. But the second is this, is that as we've quit wearing N95 masks, the demand for these masks have gone down. People aren't purchasing them. The companies have, no real outlet for their products that they're making. And our manufacturers are starting to close. This was a recent article in the Wall Street Journal. So we're going to wind up again into the situation that we had prior to the pandemic of not having adequate N95 masks for people. Hospitals aren't stockpiling pandemic levels of masks for 6 months. And if our manufacturing capability goes away, we're going to be right back to where we started from when the next virus hits, and it will do that. Unfortunately, it can be nature-made or man-made, whatever. These viruses are evolving, and we will be reinfected with another wave of significantly resistant COVID or some other virus related to COVID or not related to COVID, but is just as problematic.
Okay, okay then. I can feel my blood pressure rising just thinking about this. Yeah, I hope.
There's no good news. There's, you know,
Yeah,
I mean,
I hope we see, I hope we turn a corner. I hope eventually we see the wisdom, in continuing to manufacture. Now we're in the fifth year of the pandemic. We don't have data from every state. We don't have a COVID response task force in our federal government. Should the federal government leave it up to local governments and individuals to deal with the pandemic?
well, local government and individuals cannot have the capacity to deal with the pandemic. Uh, I mean, no, we need to have central coordination. We need to have better ventilation. We need to have secure masking. We need to have articulation to the public of the risks, the real dangers of long COVID, which, by the way, affects children also to too great of an extent. Uh, some of the research I've seen has been anywhere from 2% up to 70%, but most think it's falling between 10 to 20% of kids may have persistent symptoms. And just like adults, they can be permanent, maybe a little bit better, but not returning to baseline. So we've got to be very careful with what we're doing. And right now, this is not a local problem. And we have really lack of any government or coordinated response. They are hoping this will go away. Um, I'm very frustrated at the response that we currently have.
Well, this brings me to my next question, which is, are we out of the woods because of Paxlovid? Most insurance covers Paxlovid, but without insurance, the cost is over $1,400. How do you feel about some people unable to afford early treatment?
Well, everybody needs to have the availability of early treatment. And Paxlovid, as you know, is a very effective drug. It is, however, a first line type, or not first line drug, it is a first generation drug for COVID. And we have not had new antivirals since that time. It will depend upon the state that they're in as far as availability of Paxlovid. Sometimes you can get it through health departments or state assistance, even though the federal government payment may not be there. So I would definitely encourage people to get Paxlovid. One of the problems with Paxlovid is that there's already been viral resistance to this drug. So that if everybody were to be on Paxlovid after a couple of months, I would suspect its efficacy would its efficacy would go downhill and maybe even become not infective with the viral mutating out of a form that would be susceptible to the drug. And so we need to keep on getting new antivirals. As you know, with HIV or AIDS, it's a cocktail of 3 antivirals, not just one. So the idea that we have one antiviral that we've had for 3 years and that's going to be good for the whole pandemic, that's magical thinking. They've already detected viral resistance in some of the specimens that they've had. So it needs to be made available. Everybody needs to be on the same playing field, but it in itself is not the answer.
Well, speaking of magical thinking, people should know the basics of mitigation after 4+ years of COVID. Why have people stopped taking precautions, including medical professionals?
Well, a lot of it is, I hate to say this, but an organized disinformation campaign. I don't think it's lack of education. It's being educated and re-educated and continuing to be educated by information which discourages them from getting vaccinations, from wearing masks. The misinformation and the complexities of it, the organizations behind it are just mind-boggling. And I feel that it is really targeted at weakening our nation. There's a lot of international players in this, and they have ill intent. So it's highly organized. The doctors have fallen into it, but the doctors are also getting threatened. I mean, if they were to implement a office-wide masking policy, depending on where they live, for example, I live in Kentucky, people get very upset at this. They say it's their right to wear a mask or to not wear a mask. It's their right. And they can get extremely upset. You get threatening emails, threats made to yourself. And so it's disconcerting. It's it's, what can I say? It's something that a lot of the physicians didn't sign up for. And that will be regional, but nevertheless, it is a problem. And until the CDC gets on board and some of our government agencies and starts countering that disinformation, it's going to be very, very difficult to do otherwise. And I think that the messaging from our federal government has been inconsistent and sometimes conflicting at best.
Yes, yes. Now, the virus continues to mutate. New variants keep emerging. Does it make sense to keep getting new boosters that are made with a no longer dominant variant? And what do you think about the government's vaxxed and relaxed approach to public health?
Well, as I've stated before, it's not all or none. You have to look at dosage, you have to look at mitigation. The studies on the recent booster appear to be very positive as far as it providing a beneficial effect, but it doesn't prevent you from getting the disease. The vaccines have been very good at preventing long COVID. I mean, there is some cross-reactivity. You're talking about 50 to 75% effectiveness in prevention of long COVID. Now, with as infectious as this virus is, you're probably going to get infected, and 50 to 75%, that's not real good. I wouldn't play Russian roulette with those odds. But nevertheless, it's still worthwhile getting vaccinated. So, you shouldn't get vaxxed and relaxed, but on the other hand, you should also be vaxxed because that's one of your protections. It's kind of like if you're in a war and stating, should you wear a bulletproof vest? Well, yeah, wear one, but don't jump out of the foxhole and run around. You've got plenty of other places to get shot. So it provides you with a layer of protection. I cannot stress that more.
That's a great way to look at it. It's just a layer. So, do we gain immunity from a COVID infection or does it weaken the immune system?
Well, I think that it does both. You gain immunity to COVID, but similar to measles, it can also weaken the immune system to other infections. The immune system is like a photo album. It's not a muscle. It's not exercisable. It's a photo album. And you've got so many photo pages. So you get a COVID infection, you survive that, you've used up your photo pages for that virus and has some cross-reactivity to other variants. But when you're elderly, you then get less and less, less and less reserve to then have other infections having immunity to those. And so that's it's a problem. And the lack of immunity or immune dysfunction to other infections is what's driving RSV and what is driving other infections. And this is extremely important. And another reason why you need to get vaccinated. All of the data, and I saw one of the comments there, but this, as far as vaccines go, is a highly effective and has a very good safety profile. You can look at the data now compared to the outcomes of those who are vaxxed and those who aren't vaxxed. Those that were vaxxed have done much better in terms of long COVID and much better in terms of much better in terms of deaths and hospitalizations. And that is key. The misinformation regarding vaccines is just mind-boggling. And I'll give you one example. was the attorney, it was the Surgeon General out of Florida with vaccinations regarding regarding COVID, stating that young males had more myocarditis. And in his data, he compared, and he stated this, he compared young males' myocarditis after vaccination to the entire population who had myocarditis after infection. Well, myocarditis is more common in the young, whether it's infection or vaccination. So that's comparing apples and oranges. If you compared young males' vaccination to young males' infection, there was little difference. In fact, the vaccines were safer. Now, one exception, and you'll hear this, they can cause myocarditis in certain cohorts. Well, that cohort was like the second dose of Moderna vaccine, which is much higher, which is why some countries have recommended for the younger people to have a Pfizer vaccination. But that is just one problem. All the other problems, heart disease, kidney disease, CNS abnormalities, all of these are protected with vaccination. And the chances of having a severe reaction to vaccination is extremely small compared to a severe reaction from COVID infection. And the CDC and other entities have extremely good data showing the safety profile of this.
Excellent. That's an
Yeah,
excellent answer.
yeah. And so they, you need to realize this. And this is part of the disinformation we have. People look at VAERS database. That's publicly open. I mean, that is right now can be flooded by reports by AI bots. It's not reliable. You have to look at VSafe, which, by the way, advocates wanted to have that data opened and finally was, and it's safe. VSafe data, you look at the VA data, you look at CMS's data, you look at data from the military. This vaccine has an excellent safety profile. And you would have 75% less, 50 to 75% less cases of long COVID if everybody would have become vaccinated. And that's the key. And some people, unfortunately, like myself, I developed an infection before vaccines were available. So, and that was very, very early on, even before tests. I flew on an airplane, sat next to a gentleman that had an exhalation valve on a mask, which you shouldn't have, the day after Mardi Gras. 3 days later, I had, 4 days later, I had fever, severe somnolence, muscles and neck hurt so bad it was unbelievable, and awful diarrhea, but very little dyspnea. Back then they said it's just the cold. Dyspnea is a difficulty breathing. I had only a few hours. So I didn't think anything, I won't say I didn't think anything of it, but I didn't think I had COVID. Nevertheless, at that point, there wasn't even a test available. So that's one of the problems, by the way, with long COVID. If you got it before a test, how do you prove you even had an infection, have long COVID? Right. So that's, that is another problem that we're facing.
Well, speaking of infectious diseases and trying to identify them, is it a good idea to lump COVID together with respiratory viruses, including flu and RSV, in public health messaging?
Well, yes and no. It will depend upon the context, because really, flu and RSV are becoming more severe now that people's immune systems are messed up with COVID. I believe that, significantly. There's good data on RSV. There's some data, for example, out of Sweden of case reports of severe infections, et cetera, with influenza. So I think the idea of we've got to take care of all of these respiratory viruses makes the case stronger. I also think that the idea of saying that, well, COVID-19 is much more severe than the flu, is true, but people still die of the flu. The main problem with COVID-19 is that it has high infectivity. So it has 10 to 20 times the cases. It's just like Omicron. Everybody says, oh, Omicron was, nothing to worry about because it was just a mild disease. Well, but it caused so many more cases. There were areas in the country had more deaths than Delta. So everybody got infected with Omicron, a bunch of people got long COVID, and guess what? The immunity waned. It didn't last. So it was much more severe, but yet the narrative is it's much better. Now, that being said, you need to realize with public messaging, most people don't know the difference between a bacteria and a virus. That's what's so hard. And so when you get into specific species of viruses, it can confuse a lot of people. You can't believe the people's conception or grasp of public health. So saying that, you need to install better ventilation so you don't get sick from things that you breathe in may make sense to the population that you're talking to. And that's one of the problems. We don't have a lot of healthcare literacy or healthcare education in the United States at this point. It's one of the underlying causes of the bad situation that we're in.
Mm. Now, continuing in this vein, how much sense does it make for public health messaging to urge only high-risk patients to mask up?
Absolutely no sense, because again, that's the misdirection of what's high risk. Everybody is at high risk for long COVID. In fact, there's some data that the young have a greater risk than the elderly. Now, one of the factors may be the elderly has a higher vaccination rate, which tends to prevent long COVID. And, again, severe disease, high risk, all of that needs to be reevaluated. The high risk is for hospitalizations and deaths, but really, is that what we need to be concerned about when we have double digits in our society of people living with long COVID? It's affecting workforce, and it is something that we need to, as I said, have a paradigm shift in how we think about things.
Agreed. So, that being said, what do you think of the CDC's current guidance around 5 days of isolation? Well, actually, Julie.
No, that's old.
Yeah, that's an old question.
Yeah, that's an old question. It changes so rapidly.
Yeah, that just changed. Julie, let me jump to the, where did it go?
Can you find a new question?
Yes, no, I am. Here we go. This is what I was looking for. Here we go. The CDC will be dropping universal isolation of people who test positive with COVID. That's out today. Is this based on best evidence and science? Why is this detrimental to infection control?
Well, it's detrimental to infection control because it's causing people to lose faith, I think, in government advisements in the CDC, which then rolls over onto everything else. It's creating, I think, a great lack of confidence in our infection control system. You can't, here's the thing, it's hard to get mad at anti-science individuals when indeed the science itself is being misinterpreted and misquoted by leaders. There is no science behind that recommendation. That idea is most people won't wind up in the hospital, so I guess we'll just have chronic disease and long COVID. And when I say wind up in the hospital, that's the acute pulmonary manifestations of COVID. That's not the long-term cardiac, GI, and central nervous system manifestations. And the fatality rates may be even greater from these long-term manifestations than they are from the acute. Very frustrating. I mean, the CDC came out with this 3,000 people have died of long COVID, but, and that was from death certificates. Well, that's ridiculous. Epidemiological estimates would place the number at over 1 million because you're looking at cardiac, renal, GI. It's not good. And what's very disturbing is the CNS problems. So the CNS problems with long COVID is something that we need to be very concerned about. Brain fog affects almost 50% of individuals who have long COVID. And associated with brain fog is now memory and cognitive loss. And there's also what's called executive dysfunction. People are unable to form consensuses. They become more disagreeable. They're not able to compromise. They don't know when to get angry. They get angry and fly off the handle too often. Kind of what we're seeing in the world today. And this is, I think, going to be a severe problem. And we need to recognize this. We need to start to combat its influence. And that's a very, very important thing. One of the little questions said CNS, that's central nervous system, that's brain problems. So central nervous system problems are extremely common with long COVID, maybe the most common symptom of long COVID. And many people are starting to think that SARS-CoV-2 is not a respiratory illness. It is more of a brain and heart disease. The GI problems that you get with long COVID are now felt to be due to viral sequestra. Those will sometimes improve with a booster or vaccination. And that's something to consider if you do have GI problems post-COVID-19. However, you need to talk to your doctor because other problems are associated with immune dysfunction. They're associated with direct viral damage. So long COVID is long COVID has a myriad of presentations. SARS-CoV-2 is a multi-system disease. And that's, it's not the cold, it's not the flu. It has a different receptor and it goes after every organ and it goes after repeatedly every organ as your immunity wanes.
Okay, then. Well, that brings me to our final question, which is multiple studies have documented that asymptomatic people can spread COVID. How do you feel about California ending isolation for people testing positive if they show no symptoms?
Well, unfortunately, that's an old question because now the
That
CDC's
is
made that the recommendations of the United States, or apparently they're thinking about making it. Haven't made it yet. But that's nonsensical. It puts everybody at risk. Asymptomatic spread of COVID-19 is significant. And we need to really, really try to call up the CDC, write op-eds, do what you can to prevent that sort of an intervention from going forward. The CDC is doing crazy things. I don't know what they're doing with public health. It's unbelievable. They're being gutted. And that's under the current administration. God knows what's going to happen next year. I mean, what can I tell you? It's time for activism. And it is really then important to wear a mask because people who are asymptomatic are going to be out there spreading a virus, even if they know they're test positive. Now, I should add that people are pretty much doing that anyways. About 75% of the people in some studies have indicated that they go around when they know that they're sick or shouldn't be going around and mingling in the community. And that's not good either. But to normalize that deviance, to me, makes no sense at all.
Agreed. Well, thank you so much for spending time with us this evening and offering us your expertise. We are so grateful and appreciative.
Okay, thank you very much. I made a little video of this that has some slides that maybe if you want to share with your group would be good. And it, it has the actual tables and, a few of the diagrams and has the points and helpful hints that I have. But everything I do is done on not eliminating risks, but done to calculate to minimize risks. And I think that's the best you can do. Someone added about, the cancer center not wearing masks. Yeah, same thing happened to one of my close relatives that had to chemotherapy for colon cancer. No masks. Prior to politicization of this, everybody be wearing masks. But right now, they're not wearing masks.
Dr. Kavanagh, thank you so much for being here. I think one of the commenter or a couple of our commenters are interested in hearing a little bit more about herd immunity. There has been question about it's been shown that COVID infection only damage the immune system and reinfections can happen very quickly, especially with all the variants and lack of universal respirator usage to prevent transmission. And they would like to get a little more information from you in terms of like whether getting infected will give you immunity or actually damage your immune system.
No, getting repeated infections will probably damage your immune system to other infections and get you long COVID. You don't want to reach herd immunity with repeated infections. Herd immunity will work, for example, for measles or some of the DNA viruses that don't have such a high mutation rate, and your immunity persists. Long COVID, it won't take place. So originally, the herd immunity definition was, well, it'll completely go away. Then it went to, oh, it'll get better. You won't get that sick from it, or it'll, wane off a little bit. Well, what we're seeing now is just a trough, maybe in May or June, and the trough never bottoms out. We still have unacceptably high deaths, unacceptably high long COVID rates, and this is not sustainable by either our economy or our healthcare system. It's very concerning, and the herd immunity is proven wrong. We have one legislator in Kentucky who it seemed like prior to every peak when we were in a trough was declaring we've reached herd immunity, and then we got zapped again. Well, the same thing's going to happen. And the main strategy now is let's just not count. We're not counting infections. We're not counting hospital acquisitions. We're not counting worker acquisitions. If we don't count, there's not a problem, and this will go away. And I think it's a very, very poor strategy, but that's what we're currently being faced with.
Thank you very much, Dr. Kevin Kavanagh, for explaining this to us. And thank you for being with us tonight. I think
Okay,
everyone.
thank you. Sorry about being a little late. Had a little computer problem.
No, definitely not a problem at all. And we will definitely share your slides and the work in a different format, probably through our social media channel, or include that in the YouTube so that everyone can see the slides as well.
Julie,
Thank you so much.
Julie, we have one more question that was asked twice about, do we have time for one more?
Okay, it will cut into our break. Okay, so go ahead.
Okay, it's just it was asked twice. I missed it twice. So the question is, what do you think about nasal sprays and mouthwash before and after doctor's appointments? Do these help? And if so, what kind should we get?
That I really don't have an opinion on. It may help. I doubt if it's going to hurt. I have read some indications that it might help somewhat, but it's not something I would totally rely on, but it's not something at this point I want to take a position on. It's not going to give you protection to substitute for any of the other things we talked about, it's possible it might add a little bit, and it's something that's easy to do. So I'm not completely opposed to it, but don't rely on that as opposed to masking, vaccinations, and ventilation.
Thank you.
Thank you, Dr. Kavanagh.
Thank you.
We are really grateful for having you tonight. And thank you.
Yes,
Thank you very
thank
much.
you.
So Christina, I think we're going to take a break.
Sure.
Maybe for like five minutes. And then
Sure.
we'll
Yeah.
come back to resume with Dr. Marjorie Roberts. And
Great.
we'll talk about long COVID.
Okay, great. See you in 5.
So tonight, we want to talk about how detrimental can long COVID get. Disability is the topic for our second webinar. Our next speaker is Dr. Marjorie Roberts. In 2020, Dr. Marjorie Roberts and I were advocating about COVID on social media when we were losing loved ones and desperately trying to warn other people. We found each other and decided to join forces together with a few other advocates who also understand our country's urgent needs to educate people about COVID and a wide range of disabling and incurable long-term conditions and damage to organs and immune systems. We created MaskTogetherAmerica. In 2022, I flew to Georgia to meet with my hero. I went to celebrate Dr. Marsh's retirement and our precious friendship. Today, I'm sharing her with you. Our team is really excited about sharing our leader with all of you. And Christina, please introduce our guest speaker.
Dr. Marjorie Roberts will not leave others behind. She earned a PhD and is a certified life coach. She contracted COVID in March 2020, and it changed her life forever. Not only could she not start the life coaching business, but her health rapidly deteriorated. She endured shortness of breath, extreme fatigue, loss of teeth, fever, headaches, nausea, and hospitalization. She lost her dear friend Gary, all because of COVID-19. She experienced medical gaslighting, yet she kept moving forward. Dr. Marjorie's signature phrase is, "And yet again, I smile." She smiles though she experiences debilitating long-haul COVID symptoms every day. She has not left her fellow long haulers behind. She's a patient representative for the NIH Long COVID Recovery Program and MaskTogetherAmerica, and has been featured in many news articles and videos. Thank you so much for joining us this evening.
Thank you so much for having me. Today is day 1,419 of riding the Corona coaster, and I refuse to leave anybody behind. I refuse. I give it every day. I give it all that I got, and some days it takes all that I got.
Well, we're grateful to have you in the fight with us. So that brings us to our first question tonight. How are long haulers being abandoned by the healthcare system?
We're being abandoned because there's a lot of people in the healthcare system that don't know what to do with us. There's a lot of people that don't understand what's happening to our minds and our soul and our body. And there's a lot of people that are leaving us behind because there's really no money to be made off of us, because there's so many people that don't have health insurance, or so many people that have health insurance that don't cover the over 200 things that we know about that can be wrong with us. So it's just easier to just write us off. It's just easier to give us an aspirin or to put us on mind-changing drugs and send us off to the sunset.
Continuing in the same theme, how difficult is it to get care?
It's very difficult, and it's it's going to get even more difficult because, again, it all ties into a lot of people in the medical profession have stepped aside. And it's a lot of people, again, if you don't have health insurance and you have, like myself, if you have sarcoidosis in your lungs, or you have all this dental work that I'm still facing, or with so many, if you need intense therapy and you don't, it's no money. So again, it's sad to say, but people's priorities have changed a lot. And if you were selfish before COVID and you were in the servant role or in a position to help somebody, and you saw how fast everybody was dropping, then they turned out, they just turned away from us.
I'm sorry. That brings me to my next question, which is, what kind of support does a long hauler need?
Support from every angle. You need, because it's mental, it's physical, it's emotional, it's financially, and you need support on all levels. You need people that say they're your friends. Sometimes you just need a friend. Sometimes you just need a kind word. And all of those things we need. But then if you look at it from out, it's like, oh, she's always begging. Oh, they don't have this, they don't have that. But like I say, we just need love, peace, and soul at this point, because so many marriages and so many families have been torn apart, and friends that we knew, or friends, even myself, that I had in 2019, they kicked me to the curb. They kicked me off the curb because I'm not in those same circles anymore. My priorities are not their priorities. So you find groups like MaskTogetherAmerica, and you find groups like long COVID haulers of brain fog, and you be around like-minded people. You be around people that understand you, and you don't necessarily have to know people for them to support you. It's a lot of people that I have met on social media just because I told my story. I told my truth. I never perpetrated a fraud from day one. Way back in 2020, when I met Julie, when I met Diana Barrett, when I met Amy Watson, they helped me find my voice, and they let me know that it's okay, tell your truth and tell your story. And that's why I refuse to be quiet. I refuse to suffer in silence. And I want other long haulers to feel that way. I want other, because if you lost everything that you worked for all of your life, and you're forced into early retirement, and you're 62, 63 years old, there's no starting over. So the support that we need, again, we need financial, we need mental, we need support all the way around. If everything that comes under that umbrella, that word support, is what myself and millions of other people need.
Yes, yes. Building community while speaking up. I think those two things are essential. They go together. That brings me to our next question, which is, why is prevention so critical?
Because I don't want to see what's happening to me and millions of other people, but I truly can speak for I don't wish this on anybody. I don't wish this on anybody. And because I caught this virus back in 2020 at work, masking and everything that comes along with preventing this thing, I didn't have that option. I just went to work one day and I came home with a house guest that would never leave. So now that we fast forward here into 2024, you can do some things to prevent it. You know, it's places that you don't go. You know, it's just, you know, that you just don't go. And if you do go, then put your mask on. Get your hand sanitizers. You can still do, you know, distance yourself. There's a lot of things that people can do. And that's another reason why I speak up, because I want people to prevent this thing. You know, don't fall for the okie doke like so many people are doing. Don't fall for the okie doke. Look at a person and listen to people like myself and others who are out here all day, every day, trying to warn you. Put your mask on, wash your hands, lose some friends. You know, if you go around your friend or you around people and you hear the cough, there's one thing about COVID, that cough is very distinctive. I don't care how much you try to be, if you can tell, it's in a league of its own. You can tell. So take these preventative measures they could save your life. These preventative measures could ensure that you get to see your kids graduate, your grandkids, your great-grandkids. This can ensure that you truly get to retire after working all your life because you choose to, not because you have to. So preventing this thing from spreading and listening to people who know what they're talking about. Not that I claim to be smarter than anybody. I'm just telling people this is no joke. And if you can prevent losing all of your teeth, if you can prevent having to have so much dental work that you petrified to go to the dentist, if you can prevent, I haven't flown on the plane, I'm scared to fly. If you can prevent having anxiety in crowds, if you can prevent these things from happening to you, why not? Why not? It's very beneficial to the family dynamic now because we lost so many people. We lost family members. So many people lost. So now here it is. It's the wake up call. And this is the wake up call. Prevent it. You know, don't be ashamed to wear your mask. I don't care what nobody say all day, every day. Everywhere I go, I got my mask on. I'm masked up, masked down. I don't care what nobody say. They say, oh, that's a no. If you want to see what I looked like before, I'm sorry. But why should I risk it? I don't ever want to get that sick again ever in life. I don't ever want to get to the point in life where I can't do anything for myself. I don't want that. So if me speaking up can prevent somebody else from going through what I went through, and again, I caught this at work. I caught this in a hospital that is now closed down. The whole entire hospital shut down, and it was one of the biggest trauma hospitals here, and it closed down. So if we can prevent people from going through, that's all I'm doing.
Mm-hmm. I really like what you said about prevention granting us the ability to choose. I think that's a great statement. Now, what needs to happen in order to prevent the mass disablement of frontline essential workers?
The CDC, the powers that be, the people that have the decision, that have that have been blessed with the ability to make these decisions, not just for themselves, but for their families. This is generations that we're talking about. These people have the power to listen and not give into this greed game. But COVID-19, it's all about that dollar. And if people gonna say rah rah rah, my team, and I'm gonna say put your mask on, I need the CDC to support me. I need the government to support me. And I'm not trying to make this thing political. I'm just saying the facts. We have no power without them. So I need them. And I say that very boldly. I need them to listen to us, to invite us again to the table, and not invite me to the table and sit me on a picnic bench, or not invite me to the table and say what you want me to hear. That's why platforms like this is so crucial. This is what we have to do, because every other door is getting closed in our face because they don't want to hear the truth. But until they listen, and at some point they're going to have to listen, because COVID-19 does not discriminate. COVID-19 does not care what color your income tax form is. COVID-19 don't care how many bathrooms you have. None of that matters. So it's up to us to keep knocking on the door, keep banging on the window, because eventually some of us are going to get in.
Yeah, I couldn't agree more. Now, you've shared your struggles in many major papers. Why is it important for a long hauler to share their story?
Because the truth needs to be told. I say there is their truth and there is our truth. Our truth, again, not to be repetitive, my truth is, again, I did everything that society told me to do. Everything. So why, when I needed society, did society not listen to me? When I was in the military, I got an honorable discharge. I bought a house. I raised my daughter to be a productive member of society. I went to school 9 straight years, and I did everything that was presented to me as a child to be considered a productive member of society. But because I got COVID, and because I chose to tell everybody what happened to me and how I was suffering and the losses that so I have to tell it. I'm gonna continue to tell it. I mean, even though I'm a voice of one, I'm a group. This is a small group of people that we are, but we mighty. We mighty in this battle. And again, I have to tell, because I never, if anybody could ever tell me that I would be forced to retire after I've been working since I was 16 years old, and I get to my 61st birthday in the realization that I had lost everything, and my only option was to retire, because that's something that they couldn't take away from me. I'm not going down without a fight. And I don't want people to know that, I want the truth to be told. I want the truth to be told. It's not fair. It's not fair. And we gotta come together. I gotta speak up. I have no choice. I don't know from day to day how my day gonna be. I'm in intense therapy. Thank God for my therapist. I have an amazing lung doctor. I have an amazing primary physician. And I got a dentist I'm scared of. And I'm scared of her because the experience that I had to being trying to get my teeth and trying to figure out what happened to my mouth. I was my own brand, and yet again I smiled. And my whole mouth just crumbled. My teeth just fell out. Even one just fell out in the dentist's office. So even though I'm blessed to have the dental insurance, I'm scared. I'm in therapy to be able to go to the dentist, and I have to go because I have to finish getting these teeth out of my mouth. But when I go, the anxiety, when I get ready to go to the doctor, I'm sweating, my blood pressure up, all these different tests I done had. And reality is, it's no cure. They keep me comfortable, but you can't cure these spots on my liver. You just have to make sure what they're going to do. You can't cure this sarcoidosis in my lungs. Where's it going to go? Is it going to spread? You can't cure losing every single tooth in your mouth. You can't cure losing your best friend or you can't cure losing your mom and dad in the same day. These are things that you can't cure. But again, if I don't speak up, then what's going to happen to my daughter? I have one daughter. I gave birth to my very best friend. And she's seen me. It's days when she'd be like, I want my mom back. I want my mom back. You know, we used to travel. We used to go to St. Thomas. We used to go to St. Croix. I go to the airport to even pick up somebody. I'm nervous. And I don't even have to go in the airport. And I'm ooh, did you wear your mask on the plane? Did you touch it? So I can't be quiet.
Wow. Well, we're glad you're speaking up. I'm certainly glad you're speaking up and that you're sharing with us tonight. So that brings us to our last question, which is, how do you feel about people giving up on preventing COVID?
I feel sorry for them. I truly feel sorry for them because that means they listened to them and they didn't listen to us. I feel sorry for them because you don't have to get it. You know, you can do everything in your power not to get this awful beast. You can get this because kids, this is not fair. But if grown people don't do grown people stuff, then the kids are suffering. So I feel sorry for the people who, I block people all day, every day on social media when they say ugly things about me, when I got on the mask, when they say, I feel sorry for them because if you don't believe that COVID-19 and long COVID and everything that it entails is real, then that something is wrong. Something is really, really wrong with you. If you didn't see all those bodies that was in New York, that was piled up in the refrigerators, that nobody would ever be able to count. If you don't believe it, then I feel sorry for you. Then you got. Then you fell for the okie doke, and then you're gonna get whatever you deserve. And I don't mean to be harsh, but they're gonna get what they deserve. Because how can you not believe us? And people don't believe us. They still say, oh, you lying. You just want attention. You're such an attention seeker. Man, please. That's the last thing. That is the last thing this is not what I thought for myself. This is not when it was brought to my attention that I could talk to people and I was a people person and I was going to speak the multitude. And I didn't have no idea that long COVID was going to be what I talked about. I had no idea that losing everything that I worked for since I was 16 years old was going to be the topic of conversation. But by the grace of God now, it is. This is where I am. And it's because of people like Julie that pour into my spirit even on my worst day. It's because I'm the youngest of my siblings. And right now, I got two sisters who are suffering from dementia. Two. At the same time, I got long COVID. Who's better off? That's it. This thing is real. this thing is real. So again, I feel so sorry for people who don't believe us, because karma is a boomerang, and they laugh at us all day, every day. But what goes around comes around, and it's a lot of people that I saw years ago, and now I can't even answer them because you told me I was lying. You told me there's no way in the world that nobody could survive losing their mom and dad in the same day, when I proved to you that there were people that this happened to. When I have people who put their mom and dad in the best nursing facility they could possibly afford, they died in the same week. My friend, Sergeant Gary Mitchell, that was in we was 82nd Airborne. He the one told me to fight for this country. You fit to fight. You trained to kill. He died. Not from jumping out of a perfect good plane, but because he just happened to be in Rockville Center, New York in May of 2020.
I'm so grateful that I got to sit with you tonight and to hear you speak, and I know everybody else is, and I think I can safely speak on behalf of myself and certainly Julie and everybody else and say that we're here for you. We are absolutely here for you. We are so grateful to have you as part of our community. We are so grateful that you are willing to share with us, but also especially to keep speaking up and to keep going and to not stop, because like this was, for me, especially after the news today, this was the shot in the arm that I needed, was to keep in order to keep going. So thank you so much for sharing with us tonight.
Thank you for allowing me to have this space, because again, when you get, when you do get invited to the table and you get there and you're so excited because you got so much to tell, and then you get set on a picnic bench and pretty much told what to say, it's very disheartening. It's very disheartening. So again, I appreciate this platform and everybody who poured into my spirit to make sure that this word gets heard.
Well, we appreciate you. Thank you.
Mm-hmm.
Does anyone have questions for Dr. Roberts? You can drop it in the chat, and we still have maybe 10 more minutes, or we can have open discussion. Does anyone want to who has experience with long COVID that would like to share their experience?
We have one question I see in the chat from Molly, and she wants to know, do you encounter others with long COVID issues who still refuse to take precautions and refuse to admit that COVID caused their issues? If so, how do you navigate? Do you try to reach out or not?
Well, because I live here in Atlanta, Georgia, in the great state of Georgia, in the great city of it, all day, every day. Yeah. And I pick and choose where I go very carefully. I pick and choose whom I even let into my space at this point, because it's so valuable. Time for me is of the essence. So, I can tell quickly into a conversation if a person is coming for me. That's it. It's a wrap. I don't entertain it. It's very hard sometimes, but that's what I have to do to protect my peace of mind and my family's peace of mind. Because in the beginning, they was coming at me hard and heavy, and it was people, it was brutal. it was really brutal. I got called so many horrible names and so many things got said to me. But now, after being on almost coming up on my 4th year of this, my skin is a lot thicker than it was in March of 2020.
Oh, we just got another one. Thank you for that. We just got another question. Is there anyone in government now who is supporting our cause to protect our citizens from COVID and long COVID?
Unfortunately, I'm not. There are some people in government that are speaking up. Unfortunately, I'm not with that because I want you to speak all the way up so this question won't have to be asked. I need them to be so vocal that David Muir speaks to them every night. ABC, NBC, BBC, DZC. I want it to be heard. But because they're doing it slow and easy, I'm not privy to that, so I can't really speak on that. But I do know that there are some. It's not enough, and the ones that are saying that they are, it's not all day everyday news, and that's what I would like for them to be, because again, they're powerful, they got the voice. But if they're only going to say it in certain rooms and only going to say it in certain atmospheres, and if it's going to appear in the newspaper next to the comics, that doesn't work for me. So I'm trying to get to the ones that I hope at some point will join our fight for real, for real.
Great. Okay. We have a third one. So, what therapies have been the most helpful for you?
Talk. My talk therapy, and my journals. Yeah, because at first I was so angry, and the anger issues that I was dealing with and the way that I was feeling, and I was so mean and rude and just a piece of work. She made me start writing, and we talked about it, and we talk for hours sometimes. We just talk. She just lets me talk. So that the talk therapy and the journaling, and now my prayer calendar, or my gratitude calendar that I use now, because I didn't want the medication. You know, it was offered to me early on, and that works for some people, but that didn't work. I didn't want that, because again, I need to be as present as I possibly can, because of stuff that's going on in my family with my 2 sisters having it. So I have to be. I didn't want to be in a sleep state. And again, I didn't want to be so, and that works, I'm not knocking what work that, but the talk therapy and the journaling and the gratitude calendar and the closet that I cleaned out everything in my house and put all it's like everything in there is like my journal and motivational stuff and stuff that gives me a reason to get up every day. So that works for me.
That's all great stuff. I can co-sign the therapy and the journaling. There's something really powerful about handwriting out
Yeah.
all that's going on in your life and all your feelings. So those are great. I think we have a raised hand. Yes. Bridget, did you have a question?
Can y'all hear me?
Yes.
Amazing. Dr. Marjorie would I'm still just kind of getting over sitting with all she shared with us. It's always so, speaking of therapy, therapeutic to hear others. These sessions are just very therapeutic for me on a certain level. Especially just to feel, I think we all kind of, most of us anyway, tend to feel alone. And I really thank her for showing up and sharing with us today, and especially the part about just doing everything she can day in, day out to warn people and like constantly being a Cassandra that no one's listening to. It's not easy. um, so anyway, I just really, really appreciate her. But if just in terms of the more general conversation about long COVID, and to particularly piggyback on what she said about not being able to look after herself, and being a 38-year-old woman who currently cannot look after myself, like I can get out of bed, but it's I'm about to have to like live off mutual aid for a moment. And I've also been trying to do the various kinds of advocacy, but um, uh, I'm looking to see more support for folks with long COVID and ME nationally to get access to home care when we are severe. And I want folks to know about Canary Corps through ME Action, which is a newish initiative, as well as the Treat ME event that's we're already preparing for May 12th. Basically, if there's anyone with who is severely debilitated and believes they have ME, I'm just trying to like make sure we find each other and are able to support each other better. That's I don't I'm so brain fogged and bad today that I don't want to talk very long. But like I'm happy for folks to contact me or to like think up, or if there's any way I can be helpful um in any capacity. I don't want to keep talking because I'm so dizzy. But thank you all. I really appreciate you.
Great. Thank you. Thank you for sharing. Did I see?
Bridget, maybe you can drop your link, your email, or if there's a way that people can reach you, and also how people can reach out to Me Action. We actually have featured the director of Me Action on our platform. Actually last year. And so we're quite aware of like the action that provide resources for people for long haulers, as well as people who get viral syndromes from other infections as well, post-viral syndromes. It's not just COVID that can cause post-viral syndromes. There are other viruses and disease, including Lyme disease, that can also cause ME/CFS. So, yeah, we have a very large group of a large population in the U.S. that really needs support, patient care, and awareness and mitigation policies, and we're not getting any right now.
Well, we did get another question in, and I think this is appropriate, and it's where are there still supportive groups online? And we're certainly a supportive group online, but I'm sure there are many others. But Dr. Marjorie, do you have anything you'd like to add?
Yes, this Mask Together America is a good place to start. It is definitely a good starting point because there's so many people that are tapped into that group. Survivor Corps, even though it's not as big and bold as it was, is still there. There is also COVID Survivors for Change and COVID Survivors for Change. So those are just three that I can think of right off the top of my head. But if you, like I said, just come on to Mask Together America. Let's start there. And that way you can get connected and find out who's where, who's doing what. But there are definitely still groups out there that are doing things and that are providing safe havens where you don't have to feel, left out, or you don't have to feel like you can't be honest and tell your truth and tell your story. They're here. There are groups out here. So start first with Mask Together America. Let's get you in there, and the rest will be history.
Great answer. Great.
Again, well, thank you. Thank you, everybody, for your love and peace and support. Thank you for listening to me, and I just hope that you walk away from this segment and all the other segments with little tidbits of something that can help yourselves and help your families and try to make it through this thing. And don't think for 1 second that COVID is gone. I get so tired of people saying, oh, it's gone. Did you see the Super Bowl? No, I didn't. Because knowing that somebody's going to come away from there bringing germs. So again, everybody on this call and everybody who's going to see this recording later on down the line, thank you so much for your support. And yet again, I smile.
Thank you.
Thank you, Dr. Marge. Thank you so much for sharing your journey with us and motivating all of us to speak up. I recently also become a long hauler, and it took me close to 2 years to get a diagnosis of what's causing my eyes to get extremely dry and painful. And people just call it long COVID eyes. But that is not really what it is. The pain shoot up and they flare up because of the glands, the tear glands that get inflamed.
Mhm.
And I didn't really know what it is. And the doctor, my PCP, sent me to many doctors, different specialists. I got a sleep study, and I also was diagnosed with sleep apnea as well. And that's all after COVID. And after seeing over a dozen doctors, specialists, I finally got tested for Sjogren's. So COVID can also trigger Sjogren's. And that's, I finally got a diagnosis, and guess what? There's no cure for Sjogren's. I went to see my rheumatologist. I met with the rheumatologist twice, and she said, I'm very sorry for what you're going through, and I feel your pain. And I know that you are disabled because like you cannot drive safely anymore. And she said maybe there's a nose spray that you can try, and it seems to be effective. And so she wrote a prescription for me. Guess what? Insurance denied it. Insurance said they won't cover this nose spray. And so I'm just like, my case is much more mild than other people. And I'm just using my examples to amplify the suffering of millions of others that are dealing with long COVID symptoms and conditions that have no cure. And I'm speaking up because I want the world know that our healthcare system is broken. It's not looking after patients. People with chronic illness is like looking around for doors to open for them, but these doors are closed. And at the end of the day, after 2 years, there is no cure, no treatment for the pain, and it's just constantly flare up, and nobody care. So I work as a photographer and a writer, and when my eyes flare up, it caused me to unable to work.
Yeah.
But it doesn't matter to them.
No.
And there's no mitigation right now. And I can get another bout if I don't wear my N95 tightly around my face and avoid crowds and do all the things to stay safe. I can't rely on other people to protect me anymore. I am on my own. And that is the situation for all the long haulers. If we want to avoid reinfection, we are on our own. And that's not right. Anyway, thank you, Dr. Marsh. And we should take a break before we move on to the next speaker. Hi, Sarah.
Hey,
Sarah's here.
thanks for having me back.
Thank you.
Thank you, Dr. Marsh. Yes, Dr. Kavanagh.
Yeah, I sent you that link, the YouTube of my presentation
Okay.
with the slides. It has little slides and the narration. So
Yes, that's great. So you did a video of the slides with your
Yeah.
voice.
yeah,
Great. So I can definitely include that as a video and share on social media for our platform.
yeah, I've got the link. Would you like me to send you the file too, the source file?
You can just send it to me via email, but you can also post it here too. So other people, if they want to have access to it, you can post as a comment. So everyone can get your,
Yeah, I put it in the comment.
that's great.
It got hidden though, because there's so many comments.
Oh,
Yeah. See now, Norvax is considered as effective as mRNA vaccine. That's yes, but they're going under because no one's getting vaccinated.
Novavax?
Similar to N95 companies. It's not good. So, but yeah, let me send you I'll send you the file, but it'll go into Google Drive.
Oh, can you post it?
I can
Can
post
you-
it again in the comments.
Dr. Kavanagh, can you clarify what you just said about what is going under?
Novavax, the company, they're having problems. They're laying off people.
Novavax
Yeah,
for vaccine?
yeah.
Oh my God.
Well, people aren't getting vaccinated.
Oh,
Yeah, there was a big article out on that. Wall Street Journal had it on the N95 companies. Yeah, we have a capitalistic based public health system. So when people ignore public health and don't use public health, the companies go under. And this happened during the swine flu also, a long time ago. People geared up for masks, nobody used them, companies went bankrupt. So this happening again is not good. If we get hit with a third pandemic, we're not going to have the infrastructure.
I think the issue is also marketing budget. They really needs to have marketing budget to promote their vaccine to reach more people. And I have never seen any promotion from Novavax other than we have been like telling people to get the shot.
Yeah, I mean, I think it might be it's a different vaccine than the mRNA. And, there's some studies say it may be better, who knows? But I'm of a believer that getting different types of vaccines tends to broaden your immune exposure and
Absolutely.
maybe makes you better off. What they need is a mucosal vaccine. And that will decrease infections. And there's some that are in experimental trials, but why we don't have a warp speed for mucosal vaccines, who knows?
Are
Why
we
we
getting
don't have more
close?
antivirals? I mean, everything's stopped or been put on slow pace. The we'll get a vaccine out in 10 years or something.
But
So
are we
it's
getting
not
close
good.
in getting the mucosal vaccine?
Well, they're experimenting with them. Yeah, I mean, there have been some early reports that are very promising in some early trials, but nothing that hit the market. And of course, that, as you take through the nose and you get a big IgA response, which should impact spread, and that will be very good. But, I mean, we're never going to get rid of this thing because we never talked about animals, but that's a whole nother talk. I mean, it's into dogs, cats, deer. I mean, it's everywhere now. So we're always going to have to be faced with COVID-19. We missed our chance of snuffing it out.
Kevin, is that true of the flu virus? Viruses that are common, are they as widespread in other animal reservoirs? I mean, I know there's the whole avian flu issue.
Yeah,
but
there
as far
is.
as the
They
flu
jump back
virus,
and forth, but it appears to me that the spread between the reservoirs takes a mutation, as SARS-CoV-2 doesn't appear to, because it has a different receptor. It's the ACE2 receptor,
right?
and that's common with a lot of mammalian species. So that's
I mean,
a problem.
This whole argument about not needing vaccines more than annually, and the claim that it's okay to reduce the isolation times. There's lots of analogizing to flu that's fallacious
Yes. Well,
analogies, and
look, flu goes away.
right,
You have a small period when it's very active. So you get a vaccine that's short-lived. It's short-lived like the COVID vaccine, but it covers that narrow peak.
right.
Some
And
people do
so
get
the
two vaccines.
seasonality issue is the biggest
Yeah, it's
piece
the
of
biggest
this
issue. And
false,
there's really only 1 or 2 months, and it's still, the rates are much higher than the flu.
right? Right.
Yeah, and so I just don't think at this point we're ever going to get rid of this virus. We're going to need to learn to live with it. And that learn to live with it doesn't mean we're going to stop counting the virus and the deaths, ignore what it's doing, and just pretend like it's not there and go back the way that we were. Learning to live with it means taking some really very good steps. And unless they do that, I just don't see a good outlook. The data which I'm seeing on workers is very discerning. And I think the United States workforce now is being supplemented by immigrants. And you're seeing that quite a lot. My opinion is we're highly dependent upon them. And of course, as they get sick, drop out of the workforce, guess what? There's new immigrants. It's not a good situation. The frontline workers are terrible. They're in a terrible situation. And unfortunately, that's a large portion of our workforce. Not everybody works in a closed office, without having to see the public. One of the other things I wanted to ask was the third Wednesday of March, which would be the 20th at 7 p.m. Eastern time. We're going to have a guest. No, I'm sorry, it's 12 noon Eastern time, 12 noon. We're going to have a guest from England who's very much a advocate, but also co-presenting will be Long COVID Scotland. And I thought it would be very interesting to see what's happening in another kind of nation and world, and how they're dealing with COVID-19 and some of their problems. And so please try to attend that. We can have up to 100 people in attendance with our Zoom meeting. So I'm going to, I'll send out that. In fact, I'll put that link in the message also.
Yeah, sounds good.
Thank you, Dr. Kavanagh. We need to start our next session because it is the top of the hour. We really appreciate everything that you shared. Everyone, if you have not met me, I'm Sarah Cahill. I'm the coordinator for MaskTogetherAmerica. I will be your MC for the next 2 sessions. Thank you so much to Christina for moderating the first 2. We really appreciate that. So first off, I will hand it over to Julie to introduce the session.
So after learning so much about the danger of getting COVID and long COVID, let's clean the air. Who wants to get sick from breathing dirty air? We are really lucky to have Mask Nerd back for the second round. We learned a lot from Aaron Collins in our last forum about how to stay healthy by wearing masks properly and also cleaning the air. But believe me, we were only scratching the surface of the subject. Thank you, Aaron Collins, for being here tonight. Without wasting time, I will pass the mic to Sarah Cahill, who will introduce our guest speaker to you.
Thank you, Julie, and thank you, Aaron, for coming back so soon. We had Aaron on our last webinar, and there was a lot of call to have another session with him, so we really appreciate you being able to come back and spend some more time with us. Aaron Collins is a mechanical engineer with a background in aerosol science who's been testing and evaluating masks and sharing his findings on YouTube and his ever-growing Google Doc. This work resulted in a variety of media appearances, including New York Times, Wall Street Journal, Scientific American, CBS Mornings, Good Morning America, CNN, and BBC Radio. Aaron is also a passionate advocate for clean indoor air, having helped form Open Arrows, an open source hardware company focused around meteorology in the clean air space, as well as the Oslo Project, a 501c3 nonprofit tackling mitigation and solutions to equitably bringing clean air to those most impacted by the COVID-19 pandemic. So you are definitely the mask expert here, and we really appreciate having you, especially because we are Mask Together America, so we have that in common. We all love masks. We are going to give you a bunch of questions that we fielded from our Instagram followers.
Yeah.
And so we had a lot of interest in more Aaron time.
My pleasure, anytime.
How can someone tell if a KN95 is authentic or not? Does it always need to have a GB 2626 2019 marker on it?
So the answer is yes. So one thing to distinguish between when we talk about N95s versus KN95, N95 in the US is a regulated product. So it is a test standard that a mask is test to. It's then certified by NIH to meet those performance criteria. And the manufacturer actually has a whole bunch of supplier qualifications that they have to do. They have this quality process. They have to do internal audits. All kinds of quality system is built in there to make sure that when you buy an N95, that it's going to give you some level of performance. Now, KN95 is a Chinese test standard. Doesn't mean they're not bad masks or that the Chinese can't make great masks, and they do. It's just that it's slightly different, is that it's just a test standard. So what happens is you can test your mask against that standard, see if it conforms, but there's no one that's really like vouching to say that every mask that manufacturer made. So some of the key things that you look at are the labeling requirements that came with the KN95 standard, and that standard is GB 2626-2019 is the latest version. And in that standard has some important things that you're going to look for. I hope this will show up on camera, but I'll just describe it if it can't. One is you're going to see a manufacturer name. So in this case, I'm holding a PALCOM, and the PALCOM is the manufacturer name in this. It should have the rated designation of the performance of the device. So in this case, it's KN95, and it needs to have the standard printed on it, GB 2626-2019. So if you're missing any one of those 3 things, and there's some other things that you can have optional, like the model and stuff like that. But you have to have those 3 things for sure. And if you're missing that, let's say they don't put the GB 2626-2019, they already don't comply to the standard. And if they're not even doing the labeling right, what else are they not doing right? So I think the answer is you want to see those labels on there, and you want to buy from vendors here in the US that are vetted, because there is no, there's no regulatory control over that. So manufacturers that are based in the US that are conforming to that standard are always a good option. So like DNX has them, Armbrust has some. There are companies that are importing them, like Bonafide Masks has been doing it for a long time with PALCOM and has like all of their quality system in place. So that's kind of what you have to do if you look at KN95s. My only recommendation usually with KN95s is I would just be a little cautious of the random ones on Amazon. They probably are still going to be somewhat protective, but the performance in terms of breathability and comfort and nose wire quality they're all over the place. So stick to name brands in that space. I wish we had a regulation here in the US, and I know, the ASTM is kicking off a general public mask standard. So hopefully, there's hope in the future that we will have an ear loop type standard that has some performance criteria that we can now reference to in the US and not have to rely on a different test standard.
Thank you. And I personally had an issue recently where I wasn't sure if my auras were legitimate, and 3M also has a team that will help you verify if they are. So if you have any questions about that, there is a 3M website that you can use to verify that your products are from 3M and not from a third party. So thank you for that.
Excellent point.
By your estimation, are there any public spaces that are relatively safe or that have relatively clean air? And if so, is it due to HEPA filtration or rigorous masking policies?
That's a good question. So I think, so public spaces that are always safe are public spaces that are outdoors. So in outdoor type event situations like that, you're always getting a significant level reduction in risk because you effectively have, infinite ACH, right? You have wind blowing across you. Now there's some downstream effects and some short range type stuff that we can deal with. But in general, it's way better than an indoor space. In terms of indoor spaces, there are public spaces that are going to be slightly better. So there is now I didn't have this prepared in advance. There's a UL certification process that they're applying to buildings now that certifies that either they meet the LEED criteria or ASHRAE or a variety of other things. And so, examples like that of building code standards like LEED are going to be much better. They have minimum ventilation requirements, so you're going to have that CO2. They use MERV 13 filters in the air cleaning system. And so in general, there are better building standards. Now, the problem is, how do you know as a person that walks in that they've kept that LEED standard? How do you as a person walk in know that it is a LEED certified building? That is kind of the challenge that we have right now. And so places, unfortunately, healthcare, 6 months or 2 months ago was doing pretty good about wearing masks, but I see it falling off again on the wayside. So unfortunately, I feel like in terms of masking, in terms of general public spaces, I don't feel like I haven't been anywhere in a long time where I see a majority of people masking, except for some hospitals that were local here that were doing a good job, but that was just been unfortunately temporarily done that way. So I think the things you can use to help evaluate a building performance is one, look at density. So how many people are in it? How big is the space? I always like to look up. If there's a lot of vertical space above you, that's really good, right? So that means that there's more dilution that's going to happen. And most of the time when we talk and breathe, there's this hot, buoyant air. We don't really always think about it, but as humans, we're putting out about 100 watts of heat. So we're like a 100-watt light bulb. You put your hand above a 100-watt light bulb, you can feel that heat rising up. Same thing's happening with us. We're rising that heat up and our breath's rising up and it goes up into that space. So high ceilings can be good. And then, of course, a CO2 meter is a really good first-order estimate about how ventilation is in the space. If you go into a space and you see good CO2 levels, 600, 700, 800 ppm, it's really pretty well ventilated, especially if there's a decent number of people there. That's a good indication. If you see high CO2, the next question you ask is, do I see air cleaners in the space? Do I see portable air cleaner systems or larger air cleaner systems in the space? If you don't, then you can kind of say, okay, this place is not necessarily a well-ventilated place, and they don't seem to have very much filtration available too. So this might be a space in which there's more likelihood of transmission. So that's when you tighten that mask up a little bit and get in and get out.
Thank you. How can an individual tell if an indoor space has adequate ventilation? I think we just kind of touched on that. If there's anything else you want to say on that, otherwise I feel like we kind of covered it.
I think, use a CO2 meter. They can help you identify spaces. But one thing that I don't really use one anymore. I had one for a while. The thing to remember is that if you use a CO2 meter, then you actually have to follow what's on it. Because if it's telling you that's high and you're still going to participate in the thing, in my experience, it just adds to a level of anxiety of like, oh, I know this is bad and I'm still doing it. So part of it is like, if you have that, use that and guide it with you. If you're not going to change your thing, if you're going to that store no matter what, or you're going to get on that airplane no matter what, just keep it in your pocket. I feel like it doesn't help you, focus on what you really need to do. And if you're going to do it anyways, just wear the best mask and take other precautions that you can. If you are trying to choose spaces, then it is an effective tool. And they're very inexpensive, and I see a lot of them now, especially the Aeronet's a very common one. And then there's a few other, like a Canadian CO2 Click and a few other companies out there that are making much more affordable and battery-powered CO2 meters, which is pretty cool in my opinion.
What mask would you recommend for healthcare professionals working in patient care?
So my caveat on always this is that I always say the best fitting mask on your face, and if you're in healthcare, you need a fit test. I feel like there's not enough. I think worker protection is always this kind of weird, OSHA versus employers versus someone standing up for them and then getting in trouble for that. It's very frustrating to me. But if you are in healthcare and you're wearing an N95, ask to get fit tested. It's gonna be the most important thing. So knowing the respirator fits you well is what's giving you protection. In terms of what respirators that I like, that I don't know, and again, I'm not in the medical space, so I don't know if they often require surgical N95s. I think that you can wear standard N95s outside of certain zones where they have like operating theaters and stuff like that. You can just wear a standard N95. So in my opinion, I always like really breathable N95s. So masks like the 3M Flex, which is also available in a surgical mask style, the N1, I think it's 1804, but I'm going off of memory there. The Aura is always a great option. It fits a wide range of faces, but anything that's breathable too. So I also always like, let's see if I have it with me. If you like a bifold like the Champek. So my recommendation is a breathable mask that fits you well, because then you're going to wear it longer and you're going to wear it more comfortably, and you're going to less likely want to pull it off and do stuff like that, or just make yourself miserable. So that's my recommendation. Breathable mask, get fit tested, especially if you're in a healthcare scenario and if you're around COVID positive patients, demand to be fit tested. They have to. You're not supposed to wear a respirator without being fit tested. So tell them I'll call them if they don't. I'll come over and show up.
Is it logical to only ask high-risk patients to mask up?
No, absolutely not. It makes zero sense. I think in general there is some good evidence, like in general, it shouldn't be this way, but people that have the most bad health outcomes or have complications associated with it should absolutely be masking for their own personal protection as a layer of mitigation. But on top of that, as doctors and medical professionals, they should be, they have the requirement to do no harm, which means that they could be an infected person and you don't want to transmit it. Guess what works great as source control? Wearing a well-fitting respirator. Surgical masks are better than nothing, but wow, N95s are significantly better. So I think the answer is that it makes no sense to me in the healthcare setting that we have not realized that hospital-acquired infections, especially around COVID-19 being so prevalent, at least a lot of data showing that, that they haven't considered that. Now, I think that there is a part of the missing piece of the puzzle is that there's this weird issue with N95s in many workplaces, which is that they're workplace supplied, meaning they don't have an incentive to give you a good N95. They just want to give one that meets the criteria to limit their liability. So there's some issue around that. I think it's getting better. I see a lot more auras and stuff, but in general, there's this issue around quality of them too. So then people don't like to wear them because they get very poor quality N95s. So I think the good news is that people are talking about this. So when I hear about this, that means that people are considering this a problem. So that means these problems are starting to get churned through and people recognize it. And you're seeing hospitals more adopt this during high periods of high transmission. So people are starting to realize that this, and we've all known it for the whole time. We just have to get over this lie that we told ourselves that COVID-19 is, mild or whatever, and start to accept that it is catastrophic for society. And I think Dr. Roberts, talk before this was, very sobering, but also very, motivating for me. That's what gets me up in the morning, is to know that people are having to go through that and that they shouldn't. And so I think masking in the medical space makes zero sense. I'm excited to see the CDC kick back the healthcare acquired infection committees guidelines and make them reassess that. So I think progress is being made there. So there is hope on the horizon. Everyone that I talk to that I think is of any range of intellect is all recognizing it's a no-brainer. We need to be wearing these in healthcare. We don't need to be wearing surgical masks. It doesn't make sense. They're not effective enough.
Is it logical to only require masking in renal care and oncology clinics, but allow unmasking when people see their primary care physician or are in hospital elevators?
Any one of those situations is a source of transmission. I think there are locations that you need to have more stringent requirements of masking. the question of like, should you have to wear it with your general care practice, general care? I think, you know, this is getting a little bit beyond my expertise, so I'm not sure exactly if I had to categorize them. I think in general, if you're going to a doctor, I would expect during high respiratory, like during high periods of high transmission, which COVID has been that case for a long time, that we would be wearing masks appropriately to stop transmission at any point in time in which you have a hospital which has people who are sick going to visit them. Most people don't go to visit the hospital just for fun. So this is I think that the answer is they should be wearing masks in the hospitals. It doesn't make any sense not to.
What is barrier face covering standard ASTM F3502-21? Does a mask meeting this standard offer enough protection against COVID transmission indoors?
Yeah, so ASTM, the American Society of Testing and Metrology, I think, or methods, maybe. It's been a while. I'm a committee. I'm in it, so I should at least know it. But that was a standard generated to this idea of source control. And source control is the concept that all of us, when we're talking or breathing, are generating an aerosol and we're breathing them out. And if those aerosols happen to have COVID in it, those will become a transmission mechanism for that. And the idea was source control is about capturing those. And it turns out that if you look at the literature, the source control side is in some ways a little bit easier. Particles that were coming out of our mouth when they're wet and big are easier to capture. And the idea was, okay, well, cloth masks were never meant for inhalation protection because anyone in that space knew that cloth doesn't filter very well. So the argument was, well, but cloth masks might work as a source control mechanism. And they created the F3502 standard. It was well-meaning. It was a well-meaning standard, but the problem is that the source control standard had no way to test how effective it was at source control. So you wrote a standard and you didn't have a way to test it. So what happened is that they used inhalation style tests that we might see for respirators. And so what you saw is that F3502 really had a lot of respirator-like qualities, except if you read the standard, it says, this is not a respirator, it's just for source control. So from my perspective, it's like, it was a good attempt, but it doesn't really have a lot of validity, or it will at some point in time have more importance. I think the ASTM committee is working on a source control standard right now about how you measure that. So I think that'll be more important. That'll get assigned to all mask types. So eventually that concept will be source control and inhalation protection on a variety of masks will start to become a standard that can be called against, and especially when we talk about general public standards. Are F3502 masks so good? Well, the good news is that if you go and look at the Workplace and Workplace Plus and I guess I haven't looked in a while, so I hope it's still there. The OSHA actually was compiling a list and publishing the data of the F3502 tests, and you could see the performance, and they were testing using an inhalation test, so like a respirator style test. So it turns out that masks that are respirators performed really well in that test, not surprisingly. So there are good masks there. In general, today, I would just say, go with a rated respirator, N95, KN95, FFP2. The addition of the F3502 in the source control doesn't make any sense. There was no standard for it. They end up using respirator style tests anyway, so just stick to a respirator. You're going to be better off. Doesn't mean you can't use them. It's just that you kind of have to dig in the data a little bit to see how good of that was. So for me, it's like, keep it easy. Just stick to a rated respirator. Long way to answer that question. Sorry about that.
It's all good. What mask would you recommend for, there's a whole bunch, patients, students, teachers, low-income individuals, and families? I know we're talking about the best respirator is the one that fits your face. Is there anything that a non-healthcare professional might think about in regards to their respirator choice?
So if you're in the healthcare scenario, there are specific requirements around surgical N95s. And again, I'm not working in the healthcare space. I'm a mask nerd. I understand the science and the technology, but I am not an industrial hygienist. Those are the people that are really into that space. It's a weird word in the US. We call it industrial hygienists. Everyone else calls them industrial safety or health, employee safety, a bunch of other terms for it. But these are the individuals that actually perform fit tests. This is their specialty at understanding risks of exposure for humans. So those are the real experts in the space. But so you might want to make sure that if you're in the healthcare scenario, make sure that if you need a surgical rated N95, that you're selecting a surgical rated N95. And there are categories of like the 3M 1870 plus. Like I said, the 3M V-Flex has one. There's a lot of other ones like Halyard makes one. So if you're in the healthcare space, make sure you're selecting the correct respirator, and that surgical mask is about splash resistance. So if you're in a situation where liquids can come into contact with your mouth at a high enough velocity, you need it for like blood splattering, then you should consider that in doing that. But outside of that, you don't really need anything special. I think for students and other people, if you're not after a maximum level of protection, it's like this balancing the social side of masking and the protection side. And I think this is a tough thing that even I struggle with, which is like, there's unfortunately in society, there's some weirdness that's happening around masking and it triggers people. So sometimes you just kind of want to fly a little bit below the radar, or you just kind of want to, you want it to be discreetly masked. In general, I think that wearing a rated respirator, whether it's a KF94 or KN95, is still way better than wearing a surgical mask if it fits you well. Of course, I always say that. They're way better than surgical masks. You're getting a ton of protection. In my experience at our workplace and fit testing people, now, of course, we get feedback, so it's a little biased, like we have a fit tester, so we can know real time what they're getting. But in general, what I see is that most people get pretty easily at least 90% protection. We have a couple employees that are OSHA style fit tested with an ear loop respirator. What we find is that you need to adjust the ear toggle, so you have to add toggles to the ears and making sure that's tight fitted. But there are then fashionable choices, and that can be a good balance if you're trying to kind of fit in. When we look at low cost masking, if cost is a big driver for it, I think there's a lot of options out there. The first thought is to look at masks that are typically what I consider in the cheaper side. Yeah, it sucks because it's not fair, because the masks that are really inexpensive are ugly. Like Kimberly, I mean, no offense to those that like the duckbills. No, there's no shame in wearing a duckbill. I like Kimberly Clark's too, but Kimberly Clark's duckbill N95, very breathable and typically very reasonably priced. Prices are kind of all over the place a little bit lately, as we kind of discussed that there's a big surge in demand that happened over this winter. And so that kind of brought prices back up, but we'll probably see them come back down a little bit. But they've typically been about 50 cents, and you can reuse them. They are not one use only. You can rewear them. You need to make sure that it's still tightly fitting to your face and well sealed. But there's no issue with reusing of a respirator, so that can save you quite a bit of money. The other option is, if you really want just like the most budget option, the surgical mask fitters are actually pretty darn good for the price. And surgical masks are incredibly inexpensive, maybe 5 cents now per mask. And that is a surgical mask fitter, is you wear a surgical mask and it's a brace that would fit over your face and seal it to your face. So Fix the Masks made one for a long time. There are other ones now that are on Amazon. I haven't tested them, but there are other mask braces, and that can get you down to like 5 cents a mask, something like that, which can be, reused. So although surgical masks don't rewear very well, but they can get you down to these very low price points. Other thing to think about too is for many community care places that also, like for a while, I don't know if they still are, Planned Parenthood, of course, was providing, contraceptives and stuff like that. They're also providing PPE for a while at free or sliding scale. So if you have a sliding scale medical facility in your area or a service, check with them. They might very well be able to provide you with some PPE at below market cost. And so that might be another avenue to be able to get those kind of protection at a much more approachable way.
Thank you. I had never heard that about Planned Parenthood or other
I don't know if they
scale clinics.
I don't know if they're still doing it. For a while, the ones here locally, at least, were providing masks and PPE as part of their standard packages they had the front desk. So I don't know if they're still doing that, but a sliding scale clinic would be a good place to just ask.
No, that's great. I'm sure that's going to help a ton of people. Schools are allowing children who test positive to return to class. No one is wearing masks in a classroom. Can my well-fitting N95 mask keep me safe for the whole day if I'm the only one wearing one?
This is a very difficult question to ask, and I will try my best not to weasel out of it. The answer, so safe is always a relative metric. So the problem is we never know in a space what are the key inputs that define safety. So those would be like how many are infected, what's the ventilation, what's the filtration. Again, it's this problem with aerosol science in general, is that you can look, you just can't see it. You can't, you hold a mask, you don't know how effective it is. You can't look in a space to know, oh yeah, there's 6 air changes per hour. The answer is that of the most effective tools in our toolbox, a well-fitting respirator is by far one of the most powerful tools. besides testing, with testing's number 2, which is very frustrating for me that their CDC and other groups are trying to shorten the isolation period or effectively encouraging you not to test. But the next, other effective mechanism are respirators. They're very well protected. Safe is a hard thing to answer because there's no 0%. So that's very difficult for me. I know that's annoying to hear, but it's something I've been working on. How do we contextualize that? The thing to say is that they are very effective, that with one worn frequently can significantly reduce the probability of infection to the point where, I wear one pretty regularly, almost all the time, pretty rarely, except, obviously at home by myself or with my family. But, I have not gotten COVID, and know many people that have consistently worn respirators, even in school scenarios, that have not gotten it. I think the answer is yes, you cannot get COVID by wearing your respirator. Wear it frequently. I know that it's very difficult in school, and as a parent myself, it's very frustrating to see what we're seeing happening in schools with no consideration to who those parents might be or the students themselves. But the alternative, the only thing I try to keep things positive and hope-filled, and the answer is we have a great tool. Think about using fit testing. Think about upgrading to a nice, comfortable, breathable mask. You can significantly reduce the probability. Safe is hard, but I think that there's a good chance that, very, very good high chance that you could avoid infection, even if there was an infected person in the space in a school scenario. No guarantees, but I think it's very much in our favor. So wear a good mask. And let's all yell at the CDC together. Let's call them together tonight. Don't get me started. God, I feel like I'm in a dystopian alternate reality.
It was wild having that headline pop up the morning before this webinar, because I was thinking oh no, this is the one thing that everyone's going to want to talk about is the CDC making this decision. As
they should, because for many people in across the US, across all spectrums, people all look at this and say, we're sympathetic to the issue, which is if you have no childcare and your kid is sick and you're responsible for taking, that's a huge burden on those people. There's huge inequities in that issue. But the answer isn't to deny the science. The answer is to say, hey, we need to have sick time. We need to have parents have sick time. We need to make that happen and not deny the reality of the science and just pretend that because people have COVID that they're not going to get it again. That would have been a great story 3 years ago, but as we all know, still here. So anyways, I won't talk about that one too much. Oh, sorry for my vent there.
No, it's all right. I saw some quotes today from our local Dr. Osterholm that made me very sad. So I'm with you.
Yes.
How does someone find the right mask for them?
Good question. So we lack some tools right now. There are some apps out there. I tested one of them about a year ago. I don't know if it's still in the App Store. That I was ill prepared for this particular question. I did prepare for the rest of them, but this one I missed. So there are some apps out there that can scan your face. They'll get your NIH bivariate panel, which is the NIH. So NIH, love them, but boy, could we use some better data there. Defining mask fit for them is the width of your face and from your nose to your chin. Those two numbers somehow magically are how they determine mask fit on people. Yeah, it doesn't really make too much sense. But you can get in the panel and then it'll tell you what category is. The problem is that none of this data is published to individuals. So if you had this measurement and you went to the thing, you actually couldn't figure out what panels does an aura fit. So there are some apps that we're trying to collate that data. Those may work. In general, the answer is that for a while, companies like Armbrust and others were providing sample kits that are not to be used just for testing only. You can't wear them after that. There's a NIH requirement that you're not allowed to separate masks that are in a bundle, and they were doing that. So technically that breaks a NIH law. So I'm just letting you know, they're still perfectly fine masks, and you could, but you're not supposed to for magic reasons. And so those are good options. You can get a huge selection. I think Armbrust, I didn't check on this one, but I think Armbrust is still offering that. The other option is, there's a lot of great mask brands out there. So starting with masks that fit really well is always my recommendation. So start with the Aura. That seems to fit a huge range of faces. If you have situations where you have a taller distance from your nose to your chin, although bifolds don't work for a lot of people, but they do work for some people really if you're like, hey, it's too short here, think about bifolds or masks that are taller. And the problem that we have also is that with N95s, there's not a lot of sizes available, but I do see that a lot more in other, respirator styles. So thinking about selecting sizes and buying a couple sizes. Unfortunately, the reality is we don't have a situation where you can just go to the grocery store and they have like a whole row and you just try them out. But you can go to Korean grocery stores and they do sometimes have some great selection of KF94. So that might also be another option, is to check out the Korean grocery stores. They have great selection of KF94s that can get you started. For N95s, it's just, you got to try them, try a sampler pack from companies that are offering those. Try to buy in small volumes. Don't buy a ton at one time, even though that deal may be great, half price if you buy 300 of them. If they don't work, then you got 299 masks in a box in your house, in your basement, like me. So don't become.
But then your still COVIDing group might want them, so you can always
That's true.
give them to someone.
Yeah, and check out, I'm sure, groups that are working together on Facebook, you can share between them. Reddit had the Mask for All group that were kind of doing some of that stuff. So finding communities and groups within you, always like the Facebooks that or groups that do, blanking on the name now, that do like buy nothing groups, I think they're called. I'm blanking on that right now. Great way to trade and try stuff that way too. As always, community. It's all about finding that community, it turns out. Very helpful in these kind of situations.
Lots of families struggle with protecting their children from getting COVID. What are your recommendations for kids? I know we talked a little bit about classrooms already, but maybe outside of the classroom as well?
Yeah. So in classrooms, wear a mask as best as you can. As a parent myself, my son has to eat lunch. No one cares about masking anymore. It's difficult. So just try your best as a parent. You're going to do, I very am sympathetic to it. The answer is always just try your best. You're just reducing the probability, right? None of us get in our car and think we put our seatbelt on and we can just do whatever we want and we're never going to, nothing's going to happen to, right? We're building these layers of mitigation. So it's just trying your best to keep those layers of mitigations there. Outside of the house, you need to have a social life. So trying to do things outside when the weather's nice. I live in Minnesota, like you, Sarah. Actually, the weather's been pretty nice actually for a winter in Minnesota, but normally it's terrible, especially this time of year. So if you have guests over, think about, hey, don't come over if you have any symptoms or have had any exposure. Run an air cleaner and the space, like build the environment at your house that's safe. We do that here, so LA can have friends over. We built an environment that significantly reduces the probability of infection. It's not zero, so we have to accept some risk. But you can significantly mitigate it. You can also meet masked indoors. That's totally normal and totally fine to do. So like you can build all these layers of mitigation into the space to help reduce the probability. And that's kind of the name of the game, is like, there's no guarantees, but if we build layers and use them consistently, you can significantly reduce the probability of infection, far greater than what you see in the general public. So it's pretty effective. I just wish more people would listen.
We always wish more people would listen. It's very difficult to find masks that fit children. What do you recommend for that?
So I do have a list on my thing. I'll try to grab the link here again while we're chatting. So I do keep a list on my Google Drive that I try to keep up to date. Unfortunately, I've been a little busy the last few months with Open Arrow stuff, but I will link in the chat right now. Check out that. I try to keep a list of all the different styles that are available in general for younger children. There's not a lot of headband options in the younger sizes, so it's mostly going to be ear loops. But finding a well-fitting ear loop, I just put it in the chat. Finding a well-fitting ear loop is going to buy you a lot of protection. And then there is a huge range. I think my range is like 2 all the way up to 12. Once you get over to 12, you're starting to get into adult size masks. That gets a little bit easier. Well-fitting, breathable, comfortable, something they'll wear. And that's kind of the answer. You'll have to buy a few sizes because kids are the hardest. I mean, I've 2 years ago, we did a lot of fitting with kids. I worked a lot with kids and helping to generate some sizing information on this. And the range of kids' faces is like, I thought adults were bad and kids is like a whole nother level, because a kid that's like 4 can be all over the space, because they can be just in terms of like where they're at in their growth phases can be much different than another 4-year-old. Plus you add on top of that just the diversity of face sizes, and you can get a huge range. So kids are really tough. I gave some sizing and information there so that can help guide you. So if you get one and you're like, oh, this is way too short this way, some guiding sizing information there, take a look, be like, okay, I definitely need to get bigger in this size. So that's probably always really, Aaron, my kid's 5 and Aaron said that it would fit a 5-year-old, but it's too small for them. So then just look at the size next size up, and I can guide you. I do apologize. I wish there was a way that I could just scan your kid's face, maybe not for some legal reasons, but at least get the data and then be able to just get you a mask. I really wish that would happen soon. And I think it will. There is technology that's on the horizon. It's just like anything, it takes time, a little bit. It takes way longer than it should because there's not, unfortunately, a lot of monetary incentive, but we'll keep hoping. But those people are working on it. So don't, like, people are hard at work on this. I can promise you that.
Many people live paycheck to paycheck and can't afford NIH approved respirators. What is your recommendation for people who are struggling to stay safe? I feel like we did kind of touch on that a bit.
Yeah, so looking at community groups, for a long time, local food shelves and stuff like that were stocking. I was donating a ton of masks for a long time to our local food shelf. So check out food shelves, sliding scale communities, medical services. They can help you. I think that there are lower cost options out there. So looking online, like, I don't know how much a Palcom is a day, but like, there are very reasonably priced options out there. So take a look at some of my picks. I think for a while, I'm just curious now, so I have to answer my question myself. I'm just going to see what Bonafide is right now. And again, you can reuse masks. So, there's no problem wearing one mask for a week. So that buys you down 1/5 the cost. So you can get down to like, 10 cents a day. I understand that even for some people that can be very difficult. So I think finding a reasonable fitting mask for you by, checking the internet, looking at local community services, and rewearing can really help reduce the economic burden. Yeah, Palcom's right now about $10 for a 10 pack, and if you can wear that one for the whole week, it's about $1 a week. So I understand that it's still, for some people, it's a lot, and I think that's. I wish the government would give these out for free to people.
Can we reuse disposable N95s or KN95s or KF94s?
Yeah, any high quality respirator, yes. The filter media itself is rated, because of the original source of the design was for occupational use, really dusty conditions. So for N95s and KN95s, it's 200 milligrams of loading. And to give you context of 200 milligrams, pick a really dirty city in the US or overseas, or even like wildfire smoke. So I did the math once because, I picked a city, no offense to Shanghai in general. It just is a very dense populated place that historically has had better quality. It's much better now. But it was the equivalent of wearing that mask 24 hours a day for like 280 days to hit 200 milligrams loading. 3M has mirrored this and said that, and it gets hard to breathe in. That's when you need to change it in terms of the filter. So the most important thing is fit. It's all about making sure that mask is not changing fit over time. And what happens is, ear loops stretch, so they stop being as tight. Nose wires start to not form as well, or they start to get weak. And just the general structure of the mask can be lost. So what you can tell is, check a new mask every once in a while. Try your new mask, compare it to the worn mask, and be like, oh, wow, this is way. Then you're like, okay, I need to take this one off, and I need to go back to a new one, and kind of get comfortable with your mask style and how well it fits. I personally wear pretty much a mask a week, and I have no issues. Now, granted, I'm a mask nerd, and so we have all kinds of equipment to check it out on a daily basis if we want to. We're working hard on bringing that to everybody. But I think when those kind of tools come out, we'll be really even better. But in general, it's all about fit. So just keep an eye on that. That's going to determine how long you can wear it for. If it gets loose, it's not holding structure, and it's not sealing tight to your face, you're losing protection. The filter media, it's going to be rock solid for a long time.
Does wearing a well-fitting surgical mask with a mask brace provide the same level of protection against aerosol transmission of SARS-CoV-2 as an N95 respirator?
The answer okay, so this gets some nerdiness. Now, we all like to be super mask nerds. So if we zoom out from a broad perspective and we talk cloth mask, a loose-fitting surgical mask, okay, in the spectrum we're talking about, the range is getting tight. We're up here. We're pretty high up here. Well, a fitted surgical mask is going to provide a significant level of protection, and actually, because of the mask fitters, is now just gated by the media. Problem is that surgical mask media is not as good as N95 media. So if you are a mask fitter with an N95 got a perfect seal, you're going to get better protection with that N95. But surgical masks are pretty good. They're going to be in the mid 90% or lower, whereas a N95 would be like 97, 98% type level for that filter media. So the answer is you're going to get better protection with an N95, but that's for the filter media. Now, the mask fitter guarantees a good seal. So in my kind of in the spectrum of stuff, If you came to me and said, hey, Aaron, I have an unfitted N95, or I have a surgical mask that I've used with the mask fitter, and I know that thing sits tight to my face, I would say, actually, they're probably, that surgical mask with the mask fitter is probably a little bit better in terms of protection. If you came to me and said, Aaron, I fit tested 200 on this N95, I'm going to say, okay, yeah, you're probably getting better protection with the N95 just because you're getting a little bit better filtration. But again, we're kind of arguing it at the top end up here. So the real answer is we don't have great data on SARS-CoV-2 transmission in terms of the aerosol size and a bunch of other stuff yet. So it's a little hand wavy, but that's kind of my general rule of thumb. Surgical mask, filter media, it's okay.
As a COVID conscious community, should we exclude people who only wear well-fitting cloth masks or well-fitting surgical masks?
So my first answer is, my personal opinion is never exclude anyone for the mask that they're wearing. You never know where they're coming from. There are a lot of people that have really well-meaning intention, and they follow the recommendations of the CDC. And the CDC for a long time said that cloth masks are good enough, and or maybe they're wearing an F3502 and they think it's great. You never know where they're coming from. So I think, no, I would not exclude them. I would say, hey, look, the mask that you're wearing, you know, if it's well-fitting cloth, Don Milton, who's at the University of Maryland, they have the famous Gazoon type machine where you take this huge thing and you cough into it and they measure the particles. They did some experiments with N95, they did it with a cloth mask, and they did it with surgical mask. Now the N95 for most particle size was giving 99% source control of people who had an active SARS-CoV-2 infection. The cloth mask actually did better than the surgical mask. Why? Because the cloth mask was well fitting. So the answer is, in terms of source control, like, they're doing a pretty good job. They can do better, because if they went to an N95, they're going to have way better performance. If you came to me with a surgical mask with a mask fitter, I'd be like, yeah, that's cool. You got really good, you got 90, you're going to have great source control on that. I'm going to be wearing my respirator, so you got 99%. I'm getting picking up another 97%. Like, the probability of infection is incredibly low. Cool with me. If they came with a surgical mask, that's just kind of like one where people kind of hang it below the nose or stuff like that, that's when you'd be like, hey, look, you know, good for you for trying. Let's talk about why wearing a well-fitting mask protects you, and why that well-fitting mask is really powerful in protecting yourself. And if you're going to go through all the hassle and discomfort of wearing a mask, make sure it's really going to do protection in both ways. So that's kind of what I feel like. Always help people up their mask game. Provide them some free masks they may not have learned yet, and they're maybe new in their masking portion. So just, you know, have some empathy and be a friend.
Really quick, we had some issues at the beginning of the session with our recording not recording. And Julie wanted to make sure that we could get the answer to the air purifier question again. So is it okay if I ask that question again and you kind of give me the answer that you gave before?
I will do my best to reiterate what I had said. So yes.
Okay. How do I make sure that my air purifier is working?
So like masks and like a lot of things we talk about in aerosol science, you can't just tell how well something's working by looking at it. And that's kind of a missing piece of the puzzle that we're trying to solve right now. But there are some simple things that you can do to check to make sure that it's working. The first thing is make sure that the plastic has been removed from the air cleaner when you install the filter. It's not always entirely obvious to people that you have to. I don't blame anyone. That might be a new technology for you. But I've seen a lot of air cleaners where people have accidentally put it with the plastic still on it, and no air will go through the filter media. So check that out. Make sure that's happening. Now, for HEPA and HEPA-like devices, I saw a question in the chat, like Lavoie is no longer HEPA rated. Really what we're talking about is filter media that's really high performing in that space. What happens over time is that the particles load, the device will still filter really well. It will just filter we'll have less airflow going through the device. So if you notice that there's been a significant amount of reduction in how much air is coming out of the device, you might want to take a look at your filter. If the filter has a ton of loading on it, some things that you can do to extend the life of the filter, with the caveat being, remember asterisks, you know, always follow your manufacturer's recommended filter change cycle. But what I found effective is taking a vacuum cleaner, vacuuming off the pre-filter if it has one. That's like a thin sheet. It looks like a little mesh screen that covers it. Clean off the pre-filter. If it doesn't have a pre-filter, pop the filter out and clean with the vacuum, the outside of the filter, removing all that. And that seems to extend the lifetime. They will continue to filter as long as air is blowing through them. If it's not a CR box, CR boxes have a little bit more complication because they're using electrostatic filter media. There are some conditions which can cause them to not perform well, but you would never know it. So far, the data shows that it's pretty dang rare. So I think, again, if you're seeing good airflow through those devices, whether it's a HEPA or CR box, there's a very high probability that you're getting excellent protection. If you are in doubt, if it's been 2 years since you changed the filter, just put a new one in. That's probably the best recommendations. Like, just periodically plan to replace them. We're working hard to make those technologies so that you can do some of these kind of measurements. at home and make devices smarter so they're telling you this. That will take a little while to make it all the way to the end game, to the end consumer, but there are some stuff there. But in general, make sure that the filter's working by not being in plastic. Check to make sure it's not loaded. If it is, you can try vacuuming it. Check that airflow coming out of the device. And if you're unsure, just change the filter. You're better off safe than sorry in that case.
Thank you. All right, we have a ton of people that were really hoping that they could ask you questions, and we don't have a ton of time, but I'm going to field a couple of questions to you from the chat, if that's okay.
Please, anytime.
Okay. What do you think about wearing a ready mask under an N95?
I think that, in my opinion, if the ready mask is well fitting you, that you're not getting a significant amount of extra protection. So the ready mask, for those that don't know, is an adhesive mask that seals to your face. Now, the advantage of a mask that's sealed to your skin is that it's very hard for air to leak through if it's physically connected to your skin. That mask alone is giving you a ton of protection in terms of respiratory aerosols. Applying another mask on top of that will increase the breathingness resistance of it. So how easy it is to breathe. So you're going to be much harder to breathe in. But really, the increase in protection is going to be very, very small, like fractions of a percent. So you're getting, 99% of that protection with the first mask. You can put the second mask on and you'll get an extra 0.5%, but it's going to come in and bring very uncomfortable. My general rule of thumb is one well-fitting mask, one respirator is really the way to go. You're going to get the huge fraction of the protection for like a very small amount of cost. Double masking usually, in my opinion, doesn't really make sense. So I would not recommend it. If for some reason the ready mask didn't fit you and this was making the fit even better, sure, I guess, but I would just try to find one mask that fits your face really well in that scenario.
Thank you. Does wildfire smoke decrease the life of masks and air purifiers for protecting against COVID? One of our chat members read that wildfire smoke can remove the electrostatic charge from the filters.
So the short answer is yes. High exposure to certain types of smoke producing events can do this. It is not well understood yet. So there are some experiments with some CR boxes where they had freshly generated smoke, and that had depleted the electrostatic filter performance of the CR box. There's a lot of stuff that goes in together in terms of like concentration of the smoke, how it's freshly generated, and stuff like that. So the answer is yes, it can. In general, if you are at the wildfire is in the distance, you're not in proximity to the wildfire, very close to it, then the masks are going to work really well. They're not going to have as much symptoms of this. If you are very close to the combustion source, I think there's some data that needs to be generated about how much protection you get. In that case, my recommendation is if like you're very close to wildfire, just plan on changing those more periodically or after the wildfire to show smoke has happened to make sure it works again, because we can't see how well they work. This is the big problem. So it's better to be safe than sorry if you're like very close proximity to wildfire. New York or the East Coast wildfire smoke that you guys had to deal with this summer, we had to deal with that the summer before. That stuff's far enough away that it's aged. I haven't seen any data to show that that's a risk at all, removing electrostatic charge. So in those scenarios, not a big deal.
What are the differences between the $300 3M fit tests and the $40 fit test that you shared with us last webinar? Do you have any idea when the $40 option will be back in stock, if you have your crystal ball?
I will harass Philip, who's been working on that. I'm sure that I'm part of the problem for this because I talk about it all the time, and it's just one person trying to do their best. So I understand that there's a lot of like community driven stuff. Someone's just trying to put this together to help people and keep the price low. I get that becomes a limitation. The big difference between those and a professional fit tester that you can buy one from 3M, you can buy it from Gerson. There's a few different sell it, and they sell it with this little nebulizing bulb. There's a good piece of, if you're going to go that route, think about purchasing the QualiFit software. The software that was developed from a professor at the University of Cincinnati, which helps do that. So the difference is that is actually an OSHA approved method to doing a fit test. It has a process where you load either a sweet or bitter, stick to the bitter, it's better response. You first have a test solution to make sure you can respond to it. Then you dose a certain amount of the actual test solution, you put the hood on, you do this whole process, and there's actually a documented methodology that you have to follow to get an OSHA approved qualitative, I always mix myself, qualitative fit test. The $40 option is basically the same idea. They have a test sample and the thing, but it's not doing the nebulizing. There's not like 5 bulb pulses versus 3 bulbs. If you read the instructions, it's quite complicated. It's that simplified. And the nice thing that I like about it is it lets you very quickly find in your mask selection which ones are the best fitting for you. It doesn't necessarily guarantee you that you're getting a fit factor of 100. I don't think that's the magic number we should all be driving to anyways for the general public. So I think the answer is the $40 test will give you the range of masks that work better, and you can find the ones that fit you better. If you want to know an absolute line in the sand, then you do have to do these more specific OSHA style tests with all these different, with like the QualiFit software, and they can give you a good estimate of that. I think you're getting, for $40, you're getting like 95% of the bonus. If you really want to pay the extra money, you can get the full on setup, and you get a little bit more answers. And I don't know when it'll come back. I really hope that, and I don't think there's anything complex to it. There's not really. It's just a nebulizer, a low cost like nebulizer and some Bittrex. But it is nice that he packages it all together. I will ping him and see when he's going to have some more up there.
Thank you. All right, so we are coming pretty close to the end of our session. I wanted to give you the last 2 minutes to kind of soapbox on anything that you'd like to before we close it out.
Sure. So I think it's, you know, and listening to Dr. Roberts' story before this, I mean, I think it's sobering, the impact of COVID and long COVID on so many communities. I think on a daily basis, we look and say, society is being stupid. All of us here look at this and just shake our heads every day. But I also am a big believer in like positive, hope-filled messaging. And I think the answer is that there's a lot of things that are improving along the way. And it's hard to, sometimes we miss it because we all see the crap that's not going well. But there are a lot of good things that are happening in the space. I think the big exciting thing is like, think about how we're talking about masking today versus 2 years ago or 3 years ago. Right? We are now arguing about which is the best, most breathable N95, or do you want to do this? We're starting to develop those tools to let people get fit testing. We understand that fit's so important. We're starting to figure out, you know, what combination of ventilation and stuff like this to get an estimate, and we're getting better data. And so I think that the answer is like things in a lot of ways are going up. It's hard to see with the CDC's action and other groups, but what I see on things like ASHRAE's 241P committee, the commitment of so many people that are showing up to talk about tackling airborne transmission diseases. There's a lot of stuff that maybe y'all don't get to see that's happening behind the scenes. I only get to do it because that somehow has become my job a little bit. And there's a lot of stuff that's happening. There's a lot of passionate people. And so people like this community, sharing your voice, and being heard is very important. It motivates a lot of people who are working on this, that work is happening, that things will get better, that will be better vaccines. There'll be, you know, nasal vaccines, like this technology will get better. We will get there. We have to stay together. We have to keep working together. I need y'all to keep raising your voice, talking about these problems, because the only way this gets fixed is by people telling people that there's a problem. And I'm confident that we can do this. And I appreciate giving the opportunity to talk to y'all. If you need more mask questions, hit me up on Twitter, Mastodon, Blue Sky. I'm on all of them. I'll try my best to answer them as much as I can. Or check out my YouTube channel, throw a comment on there. If you see something, I usually answer the YouTube comments much faster because it's easier for me to deal with. But yeah, thanks very much for the time, and things will get better. People are working on this. Thank you for being a community that supports masking and sharing stories about the hardship. That's important for all of us to not lose touch of like the good stuff and the bad stuff and what motivates us. So thank you.
Thank you so much for coming back. We really, really appreciate having you. I know our community really loves having you answer questions. And like I said earlier, you know, we're all mask nerds here, so we have this kind of common thread of we're all into the same thing, which is really great.
No, it's awesome. Have you back anytime. I can talk about masks all day.
Yeah, we would love to have you. So thank you so much. Just for everyone who's still here, we're going to take about a 4-minute break. And then at the top of the hour, we're going to come back and have Dr. Kaitlin Sundling. So if you want to go grab water, snack, whatever you need, come back here in about 4 minutes.
All right. Well, thank you all.
Thank you so much, Aaron.
My pleasure.
I cannot say enough how grateful we are to have you second time. And you taught us so much. And I mean, you will continue to post on, I guess like X. You're still on X. You're not on Threads or any other platform.
Yeah, the Instagram world for me, I have a hard time converting stuff into pretty image, or just like part of my brain lacks that. It's like there's a piece that that you all have in your brain that doesn't exist in mine. Like
Threads is all text. It's not Instagram.
Yeah,
it's just Twitter.
Yes,
true.
yes,
That
we
is
need
true.
you to continue to educate us and
I agree.
any information you can share on social media, we will follow and we'll learn. And it's very important that we continue to learn so that we can spread the word. And that's something that we have to all remember.
No, I appreciate that. And I do. I think for me, that's why I like doing long format videos, because I can cover all of this in a couple different levels, right? One, a very high level, here's the stuff you just need to know. Here's for the people that know a little more detail, and okay, let's go super nerdy. And I feel like that's why I like to do those long format videos. And I just haven't had time in the last 6 months. And it's on my list to get one done about dose response and all the things we're talking about when we talk about risk, because I want to say safe, but there is no safe. There's no 0% and it never gets to 100%. There's people in that choir in 2020, only like 54 out of the 70 people got it, which is pretty amazing to me, that 14 people were around possibly two infected people for a long time and didn't get it. So it's like, how do you explain this to people that there's no zero, that we can drive it really low? It's a complex topic, and even I struggle to explain it. So it's on my list to do, and I think it's important to help contextualize all this and give people the understanding about how the magnitudes when we're talking, like when you go from 10% to 1% to 0.1 to 0.01, when you're at 0.01%, it's unresolvable as a person, whether you'll get it. It's so rare at that point. But at a society level, you'll see it. So anyways, it's on my list. It's on my list to do. I just need more time.
Thank you so much.
My pleasure.
Well, Julie, we are at the top of the hour if you want to lead us off into the next session.
Sure. And so tonight we're very fortunate to have Dr. Kaitlin Sundling here. And the topic is, how can we build safer communities and avoid pseudoscience and dangerous hype? That's the topic of the fourth webinar tonight. Our advisor, Dr. Kaitlin Sundling, whom we can trust, will help us learn about science-based mitigation tools so we can spread trustworthy information forward together. Sarah, I'm passing the mic back to you so you can introduce our speaker.
Thank you, Julie. Dr. Kaitlin Sundling is a physician scientist and assistant professor of pathology in Wisconsin, who brings her expertise in science and medicine to her public health advocacy work. As a cytopathologist, Dr. Sundling specializes in the diagnosis of cancer using small tissue or liquid samples. Dr. Sundling is a staunch advocate for healthcare masking and improved COVID protections in her community in Wisconsin as a member of the Wisconsin Community Health Action. Dr. Sundling founded the COVID precaution community on Discord to facilitate peer support and sharing science-based precautions. This online community has grown to more than 1,000 members, and we'll drop the link to that in the chat during the session as well. Her public health advocacy work has been featured in media outlets including Wisconsin Public Radio, NBC News, and Forbes. So thank you, Dr. Sundling. We're very grateful to have you here to answer our questions. We're also grateful to have you as one of our experts as a MaskTogetherAmerica member. So we're going to talk tonight about how we can build safer communities using science-based protection and kind of discuss mitigations. So we've got some questions that we fielded from Instagram. Dr. Sundling also let me know that she's good taking some questions from the chat during the Q&A as well. So if you want to drop questions, I can get to those a little bit quicker this time. But we're going to start with some pre-written ones. So Dr. Sundling, what is the impact of an infection on a healthy person versus someone who has an underlying medical condition?
Yeah, I think this is a really important question. I think what we're getting at is who is considered vulnerable to COVID? And the real answer to that is that all of us are. When you look at the list from the CDC of chronic medical conditions or general medical conditions that put people at higher risk of COVID, serious consequences from COVID, that encompasses about 75% of US adults. So common conditions, including diabetes, being overweight, being pregnant, these things are really common and they can increase the risk of serious COVID infection. And then we need to think not just about the acute infection, but also the long-term impacts. And right now, we really don't know of any group of people that we can say, yes, you're definitely going to be safe from the long-term impacts or from the acute impacts. We can't yet predict who's going to have a more severe case. There are certain things that we know put us at higher risk, but there are no things that say, you're definitely going to be okay. So we still see young, healthy people who don't have other medical conditions who are having severe impacts of COVID. And I think it's important to keep in mind that you don't need to have a specific medical condition or a specific reason, such as being immunocompromised, in order to protect yourself. Being human is a good reason to protect yourself from COVID.
Thank you. I love hearing that because that's what I always say too. I have a vascular system. I am at risk. What are some of the scientifically proven approaches to prevention that you would recommend?
So what I really recommend is combining as many proven approaches as you can. And when I say proven, the things I'm talking about are masking, improving indoor air quality through ventilation and filtration, vaccination, isolating when people are sick, staying home when you're sick, testing so that you don't expose other people when you might be ill, and those physical distancing, using virtual options, and combining as many of those approaches as you can. So that's kind of the general multi-layered approach that I would recommend. And some of those things are going to be easier for people to incorporate in their day-to-day lives and routines than others. Masking is a great one. And I think it's really important for people to understand that masking can reduce your risk drastically. I was really glad that I'm following the mask nerd, Erin Collins. I also consider myself a mask nerd, not the, of course, but masking is such a good layer of precaution. So that's something that all of us in most circumstances can control. There are situations, for example, going to the dentist and going to, for example, get an endoscopy procedure where you might not be able to mask, and then you'll have to rely on other people masking to make those situations safer. But the other mainstays, vaccination and reducing the infectious particles that are in the air through air cleaning are really important approaches to combine, because each layer that you combine will actually reduce your risk even further. So your mask is not an impenetrable shield, but it's a really good way to reduce the risk. And then if everyone's masking and you can add some of those other layers, you can reduce the risk even more.
Thank you. Donna from chat would like to know if you could share your thoughts on the general public's lack of awareness of the longer term impacts of COVID. It seems like folks are limiting their thinking to it's just a cold phase, but it impacts every organ system in the body long term.
Yeah, this is an important topic. Long COVID is definitely under-recognized, and it's often thought of something that'll happen to somebody else. People have a way of thinking about it where they think that they aren't personally at risk. I do personally know young and previously healthy people who have long COVID, and it's a really important thing for people to know in order to know why they should protect themselves. This, I would really say, is a true public health issue that our public health authorities need to do better in educating people, raising awareness. Our public health authorities here in the US have the infrastructure to share this information. When we don't have that in sort of being done in large campaigns, for example, seeing an ad on TV about long COVID, that would be just knowing why people should protect themselves would be really impactful when combined with appropriate precautions, rules, and regulations to protect people. So I think that in the absence of those things, we're doing the best we can to spread awareness. And I'm grateful for all the people who are here. You can make a difference in your own communities and in your own circles to share good information and look for opportunities where people are wondering about folks getting sick more often than they used to, or people who aren't bouncing back from an infection. Also, if you know people who may have a COVID infection recently, helping them understand the importance of resting and also treatment of COVID infection using Paxlovid. That's an important thing for people to know, that they should get medical care to treat a COVID infection early. And there are telehealth options available to get Paxlovid, get an appointment and get Paxlovid for free in the US still. That program has been extended. So, yeah.
What is your opinion of things like nose sprays, mouthwashes, and supplements that claim that they treat or prevent COVID?
This is a hot topic. This is really something that's important to take with a grain of salt, that what you read online about ways to prevent COVID, some of it is good information and some of it's not. So the nasal sprays, mouthwashes, and supplements, I don't currently recommend any of them. There are some that are being studied. So I think some of them are in a, like, it's too soon to say. It's not that they're like good or bad, it's that we don't have enough information about both the risks and the benefits to say that these approaches definitely work or definitely don't work. In the US, we don't have any nasal sprays or mouthwashes that are FDA approved to prevent or treat COVID. So I really encourage people to use the proven layers of precaution. So, for example, you might be better off spending your money upgrading your mask, going with, buying a small HEPA air purifier rather than spending money on some of these products that aren't proven to work. Some of them are getting to the level of like modern day snake oil, and they're being marketed on social media. So just be wary. Unfortunately, false marketing claims are pretty rampant. I've seen these nasal sprays marketed with the claim that they will kill 99.9% of viruses in 2 minutes. I can tell you there is no biological way for that to be true. So unfortunately, it takes time for enforcement of false marketing claims to kind of come to fruition. So, and some of these things don't get caught either. So just be wary. If you do decide to try any kind of drugs or supplements, even if they're nasal sprays. A nasal spray, if it has an active ingredient, if it's not just sterile saline, that is actually a drug, and it can have certain risks with it. If you do decide to try anything like that, make sure that you check with your doctor and check with your pharmacist for any sort of medication interactions or any risks to you personally. But I don't recommend those approaches, and I do recommend that people just be careful. Ask somebody that you trust. I field a lot of these questions, and kind of like, people will ask me about specific studies. I'm, certainly happy to take a look at those. So far, everything has been not good enough to the point where I would recommend it.
What can you say to people that don't think it's necessary to mask around their family?
That's tough. I think that we've been up against a feeling that COVID happens to other people, or that you won't get COVID from someone you love, someone you know, someone you trust. When you actually look at the ways that COVID is spreading, it's spreading very readily amongst people who interact regularly. And these are the people that we know, the people we love, the people we trust. And it's not anyone's fault that COVID is spreading this way. It's, we all need to take precautions, and it's not rude to set boundaries with family members and say that, hey, if we're going to get together, we need to mask, and to set a level of precaution that everyone in that group is going to be taking. I think that that's a tough thing to navigate socially, but I don't think anyone should feel awkward about asking for those precautions. It's very scientifically supported, and there are guides and resources that can kind of help with, okay, here's a reference of, here are the different layers of precaution that we can take to make this family get together safer so that everyone's on the same page. It's not just me being demanding, it's actually supported by groups of people who care about public health and include, medical experts like me, public health experts like I know there are others in the audience here today, and other people who care about protecting our communities. So I hope that might help people feel empowered to ask for those precautions.
Some states, and now apparently the CDC, are shortening isolation guidance for people who have COVID. Is that safe?
It's definitely not safe to go shorter for isolation guidance. Actually, we should be extending isolation guidance and supporting people through isolation. When people ask me how long they should isolate if they test positive for COVID, my answer is the ideal would be 10 to 14 days. The more that you can do, the better. I do recommend testing and 2 negative tests at least 24 hours apart before exiting isolation. Just doing the best that you can. I know not everyone's in a situation where they are able to fully isolate for that time, but if you can isolate for part of the time and take precautions for the other part of the time, like masking, and increasing the, air purifiers in some shared spaces, that can also help. But yeah, this idea that a one-day isolation or potentially no isolation might be necessary is really concerning to me. It's a step in the wrong direction, and it's definitely going to expose more people to COVID. It's also going to lead to people having less supported time off at work. People are going to be, even more than they are today, compelled to go to work earlier when they should be resting and recuperating from their infection. That's a really important thing, both for just general recovery and for preventing the development of long COVID. We know rest is really important, and having a really mindful and careful approach to returning to activity. That's super important. So people should have time off when they're sick, even if it's not COVID. But so I'm very concerned about these developments. The new reports out of the CDC are not set in stone. There should be a public comment period on that, and I'm hoping that some of our public health advocacy groups will be working on this. I'm certainly working on this, and working on some initiatives to bring more awareness to this and the need for extended isolation and financial support for people so that they can actually isolate appropriately. The excuse that businesses can't tolerate a longer isolation, there needs to be government support so that businesses are able to give people the time off that they need to keep from spreading the virus and to recover.
Thank you.
Thank you, Julie. The CDC will take comments in April. Thank you.
Has Paxlovid been shown to help prevent long COVID yet? And should we seek Paxlovid for every COVID infection or only when we get very, very sick?
So the first thing that I want to say is that it's really important to seek Paxlovid early. It really needs to be given within the first 5 days. Now, if you're on the cusp of that, I would still seek medical care and ask if you can get Paxlovid. The 5 days is not necessarily written in stone. That's just how the guidelines have been written. So, so you don't want to wait until your symptoms get more severe to treat the disease. So the reason to take Paxlovid is to prevent severe infections rather than to only treat a severe infection. That's actually what it's intended for, is for early treatment. As far as prevention of long COVID, the studies have been a little bit mixed on this, but on average, the studies are showing that there is a benefit. It's just a little bit variable from one study to the next. So you've probably seen some news headlines that said it doesn't help, but there are multiple studies and many of them do show a benefit, but we'll see how that comes out. The clear benefit for Paxlovid is preventing severe acute disease. And as I said before, we don't know who's going to get a more severe infection, and even people who are relatively young, previously healthy, have told me that their COVID infection really knocked them out for quite a while, and it was more severe than they were expecting, even if they didn't have to go to the hospital. This is really something that is important to keep in mind when you're considering treatment, is that Paxlovid can help keep the disease from getting to that more severe point and help people feel better. I will just give the caveat that rebound can occur. Even without Paxlovid treatment, COVID can follow a waxing and waning course. That means like some days you might test positive and some days you might test negative over the course of an infection. So it's really important to keep in mind that you want to continue isolating until your symptoms are resolved and you're testing negative consistently. And with Paxlovid, I would just err on the side of caution in ending isolation. Paxlovid will not make the infection worse if rebound does occur, but that rebound isn't worse than it would have been if you hadn't taken Paxlovid. But it's just something to keep an eye out for, because people often feel so much better when they're actually on the Paxlovid, and then the rebound kind of catches them by surprise that they might take a couple of days of feeling ill or testing positive at the tail end of their infection.
What is the best way to use rapid antigen tests these days?
So I really encourage using rapid antigen tests as part of a multi-layered approach. It's really going to be difficult to use them on their own as a single precaution, as sort of like putting all your eggs in one basket and saying, if I test negative on this rapid antigen test, it's going to be fully safe to gather with other people who also are testing negative or something like that. I would really encourage a multi-layered approach, because we know that the rapid antigen tests miss more cases early in infection, and also that the timing of when people are testing positive is a bit different than it used to be. With current variants, there was just a study that came out that day 4 of infection is actually when people are having the higher viral load. So that might delay, you might actually have a COVID infection be contagious and you may or may not have symptoms in the first few days of infection, and you may test negative. And then you might test positive after you've, potentially been spreading the virus for a couple of days. So a negative test is not a free pass to sort of not take other precautions, but I do think rapid antigen testing combined with masking, cleaning the air, and other precautions can be a really useful approach. The most useful thing is to make sure that people who actively have COVID don't join a certain gathering, or, if you're not feeling well, so that you can find out if you have COVID and seek Paxlovid treatment. A positive test is really trustworthy on these rapid antigen tests. It's just that a negative test doesn't mean that you don't have COVID.
So from the chat, I thought that the test to treat program severely restricted its eligibility to the un or underinsured only. So access to Paxlovid for the insured would totally be at the whims of whatever potentially biased or dismissive doctor they see, either via telehealth or in person. Is there any way around this, or to better advocate for people who are genuinely eligible for Paxlovid?
So someone may be able to correct me if there's been a change in this recently, but as I understand it, the Test to Treat program actually has two parts. And one part is for people who are uninsured or underinsured, and that gets them free tests. The second part is available to everybody. That's if you have a positive test, you can get the free telehealth appointment in Paxlovid. I believe that's still the case, but please correct me if I'm wrong. And there are also state programs that can provide free telehealth appointments in Paxlovid. If it's prescribed, we have one in Wisconsin, but these may be available in other states as well.
I know Minnesota had an agreement with the Q rapid test or NAT test company where you could get free telehealth for Paxlovid through them, but I'm not sure if that's still going.
Sarah, Derek Blackwell just informed us that cost for Paxlovid is now $13.90. Derek said that he called several Walgreens locations and confirmed someone had paid 1,000 plus. Only about 200 was covered by insurance.
Wow. Wow, it's just incredible. And it's not easy enough for people to know that these free programs are available, and these free programs are available now, but they aren't necessarily available forever. So it is really important to contact your elected officials, let them know that you want those programs to continue so that funding is continued for those programs. Yeah, people should not be bearing the cost of treating COVID. This is really a whole society problem that we are allowing COVID to spread in the US. This is something that individuals shouldn't have to take on the cost if they are infected.
Is there any such thing as boosting your immune system? And does boosting your immune system help prevent COVID?
This is kind of a hot topic. I think I've seen a couple of things about this recently, some things that have actually been really good. The immune system is incredibly complex. I know this because I teach this to undergraduate students, and I'm not an immunologist, so I always tell this to the undergrads too, that, you know, it's just so complex. So you can't really think of the immune system as only doing one thing. We think of the immune system as fighting infections, but our immune systems are keeping all sorts of different things in balance and figuring out, you know, is this an infection? Is this a pathogen? Or is this maybe a normal part of our bodies that shouldn't be attacked? And when you hear about autoimmune diseases, that means that decision point went wrong. And you actually don't want overactivity in your immune system. You actually can't really boost your immunity in that way. So it's sort of, you wouldn't want it, and you also can't really do it. So that's kind of a two-part thing, but the safe way to boost your immunity to COVID is to be vaccinated for COVID. And I think a really important message right now, because here we are at sort of like, I mean, maybe getting toward the end of winter, if people haven't gotten the updated COVID vaccines, it's a really good time to get up to date. Those updated vaccines are still available, and they work against the currently circulating JN1 variant. It's really important to get up to date vaccination. That's the safe way to boost your immune system. That's telling your immune system what to look for and kind of training your immune system, saying, hey, here's what COVID looks like. This is what you should attack. The next time you see it, it'll have a better time of attacking COVID. But of course, vaccination alone is not enough. And that's one of the reasons why we're all here with Mask Together America.
Well said. A question from the chat was, my husband cannot take Paxlovid due to various heart drugs. I'm not sure if this is Lagevrio or Lagevrio. Is that as a second choice, a safe and helpful option?
Yeah, so I think I've heard Lagevrio, but I may be mispronouncing it as well. But this other option is still on the list of the recommended treatments for COVID, and it is recommended in this specific scenario, of course, with medical supervision. If your doctor recommends Lagevrio or molnupiravir is the other, the sort of non-brand name. I would definitely take that if it were me. It's important to treat this virus, and these are the options that are available to us currently. Hopefully there will be more options in the future for people who can't take either of those, but for now, that's what we have, and I would definitely recommend taking them.
This is the 5th year of the pandemic. Does the US have all the tools we need to avoid getting infected with COVID-19, including access to non-pharmaceutical interventions such as masks, air purifiers, tests, and up-to-date reporting of infection levels?
We have parts, but they're not being used. We have some of these resources. They are not widely available. So, we have access to masks. People have to buy the masks on their own. We all probably are purchasing masks. There are some masks that are freely available, but they're few and far between, at least in my community. We have community groups who are working on mask distribution because our government and public health authorities don't have widespread mask distribution in places that are convenient and easily accessible for people. As far as the technology goes, we do actually have what we would need to greatly improve the situation. But we need to actually use those measures. We need to make sure that people know that they should be protecting themselves. We need to provide, rules so that people can follow them and keep themselves safe. So I think that those approaches to make approaches that make making the right decision easy are lacking in our approach. So as far as monitoring the current COVID situation, we're lucky that we still have wastewater monitoring. That has been a very helpful approach, and that can tell us that COVID is still spreading across the country. But we've lost individual case testing data, and we do really feel that it doesn't get to that granular level that we used to have, and you can't make a direct connection between the current wastewater levels and what the case levels used to be. There are some estimates that try to get at this, people who are trying to do modeling, but the data is not the same. We don't have as much data as we used to, and that's a lack of support for understanding where we are in the ongoing pandemic. So, yes, there are technologies that exist. They're not broadly implemented, and we're really seeing this sort of continuation of, I can't even call it vaxxed and relaxed anymore, because only about 1 in 5 adults and 1 in 10 children have gotten the updated COVID vaccines. And that is really unfortunate. Everyone should be getting these vaccines, and we should all have access to, and not sort of be at our own expense, to take the other precautions, masking, improving ventilation and indoor air quality, and having things like paid sick leave. These things should be available to help people protect themselves and protect their communities.
What is your recommendation in regards to asking for metformin when you get a COVID infection, based on the studies around metformin and long COVID?
So metformin is one of these that is kind of uncertain. So there are some studies that show a benefit, but they're pretty early still when you look at, clinical studies and the amount of evidence that doctors want to see, that we want to see. prescribe these medications myself. I'm a pathologist, so I work behind the scenes in the lab. So I unfortunately don't have personal experience with these approaches, but I have heard from a number of people who are asking these questions. And I think when I think about metformin and what I hear from, primary care doctors, there are a lot of people who may take metformin for other reasons, and people who may be eligible for metformin because they have diabetes or prediabetes. This would be like a good opportunity to have that conversation with your doctor if you've been recommended to take metformin in the past, but you were kind of on the fence about it. So if you're interested in it, this is a good opportunity to kind of revisit that conversation if it was recommended to you in the past. However, as far as a context specifically for COVID, I haven't seen any clinical guidelines that recommend metformin, and that's kind of the bar of sort of evidence and sort of clinical practice recommendations. We want to see like our professional societies recommending it and these sorts of things that can help back us up if you want to make that prescription. And I haven't seen anything like that. So I do think it's not necessarily broadly recommended, but like I said, particularly for people who have prediabetes, diabetes, and risk factors related to those, I think it is worth having a conversation with your doctor.
Although some healthcare settings have returned to masking, others have not. How should we approach safely accessing medical care?
This is still so much tougher than it should be. Even those healthcare settings that have returned to masking, they aren't broadly using N95 respirators in many cases. We're seeing surgical masks, which certainly universal masking with surgical masks is definitely better than no masking. So I do think that that's a good thing. But still, we're seeing medical settings where there isn't masking, and the risk of transmission, the risk of getting COVID in those settings is unacceptably high. So I do recommend that people advocate for masking when they have planned medical care, or even if you're already in that environment, don't be afraid to ask for masking if you feel comfortable. It shouldn't be on the patient to advocate for these basic infection control measures, but that's kind of where we are. One update that I'll provide is that the CDC's Infection Control Committee recently sent back guidelines for further review. Those were the guidelines that would have rolled back masking and infection control protections even more than they are today. So those guidelines would have made things more dangerous. And we're seeing those being reviewed again. So there is an opportunity to provide more input to encourage greater universal masking and broader use of N95 respirators in healthcare settings. So, wearing the best mask that you have available and then asking your healthcare providers to mask is still something that I highly recommend advocating for if you can. And I hope that as a medical field that we'll get there as far as taking those precautions ourselves, because all physicians should know that we all need to protect ourselves too, and we need to protect our patients. This is something all of us should be doing.
Do you think that we should be vaccinated 2 times a year with the information that we currently have?
That is what I would recommend, is at least twice a year vaccination. Right now, the eligibility is more limited, and we're basically in the US on an annual schedule unless you are immunocompromised. So this is one of the recent campaigns that I've participated in to try and advocate for twice a year vaccination and more frequent updates to the vaccine formulations. The CDC's vaccine committee will be meeting soon, and public comment is currently open for that committee meeting. I can share that in the chat. There's a campaign for it. So yeah, for people who are eligible and can get it, I definitely recommend twice a year vaccination if you can, and once a year for people, you know, if someone hasn't gotten the updated vaccine, I think the moral of the story is like now is a great time to get the updated vaccine, regardless of what you've had in the past.
With that in mind, would you recommend, knowing that the last time I went in last fall, there was no vaccine card, they didn't ask for any proof of prior vaccination or anything, knowing like you could go into a pharmacy 6 months after your fall vaccine and get another vaccine, is that something that people should consider doing on their own, or because that's not the current CDC approval, should we not be doing that unless the approval changes?
So here's what I'll say. There is no shortage of vaccine access right now. Like there's no shortage of vaccines. It's not like waiting in line. I think many of us remember from early in the pandemic that there were these phases that, you know, there was worry about people jumping the line. Is it ethical, et cetera? No one should let that idea hold them back from getting a vaccine. The eligibility is based on a self-report. And it's not supposed to be incredibly restrictive. So if you self-report as immunocompromised, that is supposed to be sufficient. As far as anything beyond that, I would definitely recommend that people talk with their individual medical providers about whether they should get vaccines more frequently. I wish I could say that all doctors are knowledgeable about this, but unfortunately we are seeing some physicians who aren't recommending vaccination. And if that's the case, that should be a red flag that's not really good advice. But as far as, you know, people who are immunocompromised, definitely talk with your doctor about, you know, what type of vaccine. It's actually not dictated how the spacing of vaccines should be. So that's more of an individual medical decision, whether it should be only twice a year or something, some different schedule than that. That would be based on, you know, people's individual medical situations. But I definitely encourage interpreting the eligibility broadly. And that's one of the pieces of the campaign for, you know, greater access, is that you look at the list of chronic medical conditions that increase the risk of COVID. Many of those are not really considered immunocompromising conditions, but we know that that so many people have these medical conditions. So I would just encourage looking at it broadly. And if you do have individual questions, get advice from a medical provider who hopefully supports vaccination overall.
And just as a general reminder to the chat, that list of CDC conditions is so broad. Physical inactivity is a risk factor. If you're not exercising multiple times a week, that is a risk factor. So truly, I think a lot of us fall into that CDC list without even being aware of it. If you have anxiety, depression, asthma, if you don't work out, I mean, the list is really huge. So it might be worth looking at that list again if you haven't looked at it recently, because there are a lot of medical conditions that do qualify as a high risk. I read that air sampling for COVID detection might be possible. Will something like this be available soon?
This is an interesting and exciting area of research. There's actually local research here in Wisconsin looking at air sampling in schools. It's important to know that the current approaches to air sampling are not providing real-time detection. So you will see ads for things, devices that claim to detect COVID in real time from the air. And those are really just false claims. So that's not really possible, unfortunately, with current approaches. But I do think air sampling is a promising approach to surveillance. It's interesting to think about how you would approach it if there is that delay, which I anticipate that there would be a delay in detection, because you're sampling the air, and if everyone is breathing the air, then people are in that risky environment when they find out they've been exposed. So it more fits into an overall approach of monitoring for COVID and doing contact tracing, which sounds like maybe an old-fashioned idea, but that's something that we absolutely should have as a public health approach, but not really a preventative approach that we would hope to have we want to avoid being exposed to COVID. So there are ways that you could use air sampling if, for example, people had it in their homes. I'm not sure whether something like that will be sort of feasible and affordable for a long, sort of widespread distribution, but that would be kind of like more on the someday maybe side of research and innovation.
How reliable is a negative rapid test if it's taken to see if it's safe to visit with others?
Not very reliable, I would just say. There are different numbers that you can find on this, and it kind of depends on the situation. It depends whether you have symptoms or not, and then it's varied a lot from, different variants, and there's a little bit of variability between testing brands as well. But a negative test does not rule out COVID. If you have symptoms and you have a negative test, you should absolutely not gather with people. Because either you have early COVID or you have something else, and you probably shouldn't be spreading that either. Now, I know there are lots of chronic conditions that can provide like this confusion, like, do I have COVID or do I have allergies? I mean, this is what we've been hearing all along, but to be on the safe side, it's better to just reschedule that gathering, especially if it's just like a social thing. This is not something that we should be doing as a society. This is something we should be learning, is that if we're ill, that's the time to stay home and rest, recuperate, feel better. Because, if it is influenza, RSV, one of the other many viruses that we may not frequently specifically detect for, if it's a mild cold for you, it may not be a cold for somebody else. And we can't necessarily predict that. And actually, people don't necessarily know if they're immunocompromised until they start, developing some kind of symptoms or, having exposure. So you don't want to test people that way. So this is, we don't all know if we're at high risk sometimes until we're challenged in that way. So it's definitely safer to stay home if you have symptoms. But like I said before, a negative rapid test can be helpful, but I would still combine it with other layers of precaution, such as masking.
What are we doing wrong in the US for us to underperform in reducing transmission despite abundant resources?
I think this comes down to a common theme of not enough focus on prevention of infection, a very individualized approach to medicine and public health. You look at a lot of our public health authorities, and I'm a physician myself, so I'm not saying anything bad about physicians, but you see a lot of physicians in these roles, and you can see this come through as like, an individual focus rather than a societal approach. The idea that when you have an infectious disease spreading, we need to actually protect everybody. We can't let that run rampant. We need to take every measure, every person, including people who feel they may not be particularly vulnerable. Now, as we've been talking about, everyone is vulnerable to COVID, but that we all need to take precautions, and that we need a concerted societal approach to do that. So I think that's something that we are lacking in I'll say we're lacking in the US, and there are other countries who are not doing well on this as well. So it's not just us, but I think we are definitely not keeping up the support that we should have so that people know what to do in order to protect themselves and in order to protect their communities.
What advice do you have for people who have lost hope that this pandemic will end in our lifetimes?
My advice is to get involved in some way. I think that it can be easy to feel like there's nothing we can do about this. It can be easy to feel like the problem is too big, and the problem is too big for any of us to solve individually. We know that there are things in our daily lives that are much riskier than they should be because it continues to spread. But when I really look at people who are helping each other, groups like this where we have, we have such a large number of people here today to get good information and to support each other. This is really inspiring to me, and it helps me to be able to do something about it. So I think what it is that you do might be different for each person. So I think thinking about what kind of influence can you have? Is wearing a mask, the most that you can do? Wearing a mask is a really important thing these days. Wearing a mask actually shows other people that, hey, there's this person in my life that cares about COVID, and maybe I should think about doing that too. But maybe you can go beyond that and get involved with a local group or a national group, share campaigns on social media. I think all these sorts of things can help you feel like you are having an impact that's beyond just yourself. I think the worst part about all of this is that it is so isolating. And people still tell me, at least once a week I hear things about, oh, I didn't know there were so many other people who were taking these precautions, so many other people who are still masking. I'm the only one I know who's still masking. Well, today here you can look around and see there are all these other people who are masking, and we're all supporting each other. It's just that we don't actually see each other all in real life. There are people in real life in at least, in your state, in your region, who are still masking. If you can find 2 to 3 other people in your area, you might be able to start a group and make some change locally and just support each other. I think these are just important things to think about and things that definitely have given me hope.
Common rhetoric says that since we've built up population-wide immunity, does that mean we won't see any other deadly waves? Are we out of the woods?
Unfortunately, we are not out of the woods, and the proof is kind of all around us right now. We've done kind of the vaxxed and relaxed thing here in the U.S., and there were people who theorized, years ago that we would have vaccination immunity, and then you would have infection-based immunity, and somehow that would combine to be enough to provide a population level of protection. That has been thoroughly really debunked. It's really kind of a herd immunity approach that is not likely to work for COVID, unfortunately. Of course, infection-based immunity is not a safe way to get immunity. We know that COVID causes damage, and that damage, you have a chance of having severe impacts, both short and long term, each time you're infected with COVID. So it's not that you get some kind of benefit from a COVID infection. You actually have a risk of having organ system damage, which is not a good trade-off. There isn't broad immunity from previous infections as well. So you get infected with one variant, you might have a little period of having some antibodies against that same variant, but that only lasts for a brief time, and it doesn't it's not guaranteed to provide protection against other variants. So again, vaccination is the safe way to provide some protection, but we are seeing that, you know, people who are vaccinated can still be infected. And once people are infected with COVID, they can still spread COVID to others. So it's really clear these days that a vaccine-only approach is not sufficient, but that's not to say that it's hopeless. We definitely have other measures we know that work. Masking is a key one. Cleaning the air and providing, you know, lots of safer options, you know, virtual options and physical distancing options are really key to sort of a multi-layered approach that can get us to a better place.
All right, our last question for tonight. Is there a downside for a young, healthy person getting as many boosters as they're allowed?
There's really no downside. These vaccines have been proven to be really, really safe. There are potential side effects. I think people get confused about you know, feeling a little ill for a couple of days after a vaccine, and can sometimes feel like that is harmful to them. There are certainly people who can't have vaccines, and those will be people who know, based on discussions with their individual medical provider, that they need to get a certain type of vaccine, or that they need to be careful about the timing of their vaccines. But I do know quite a few people who've been able to get fully vaccinated, even though they had you know, a more intense reaction to one of the vaccines. But really safe vaccines, serious side effects are incredibly rare. And the risks of having COVID without having vaccination in place are so much more. It's really important to get the vaccines to prevent the more severe consequences of COVID. So that includes both acute infection and, as we know, long COVID. Vaccination reduces the risk of long COVID. So I really encourage everybody to get up to date on vaccines, including young people, perhaps especially young people. I do think, as far as long COVID goes, young people have a lot to lose because of how long this is going on and how many potential infections young people may have in their lifetimes. So I really encourage everyone to get vaccinated. And I mean, it's not just about, you know, sort of organ damage and long COVID. It's actually about feeling better if you have a COVID infection. It's less likely to cause severe symptoms if you have been vaccinated. So we know we need to take other precautions too, but vaccination is a really easy one, and it's something you definitely want to have if you are exposed, despite your best efforts. So I really encourage vaccination as really a foundational component, a key piece of preventing the harm from COVID.
Thank you so much. I wanted to just give you the opportunity to soapbox for a minute or two if there's anything in particular that you would like to address that we didn't get to.
You know, I'm going to revisit a couple of things that we actually did already address, but I think that bear repeating. When I think about the current COVID situation, I really think that the reason for hope is in all of us, all of the people that are here, all of the people that are working to make the situation better. That's what makes me feel hopeful about this. We are working toward a better future. I am so encouraged to see all of you here. You're all masking, you're getting good information, you're sharing good information, and that's incredibly important. We have a lot of misinformation out there. Unfortunately, some of the misinformation comes from people who we ought to be able to trust. There are lots of folks, including healthcare workers like me, people who work in public health, and many others from all walks of life who are trying to get better protections, trying to get better resources, and improving the rules and regulations so it's really easy for people to do the right thing. We can absolutely make a difference through both our individual and our collective actions. I mentioned earlier the CDC's dangerous infection control guidance for healthcare settings that would have rolled back the use of N95 respirators and put healthcare workers and patients at risk in some very dangerous situations. That was sent back for further review because of the public outcry. So in these circumstances, you need to make your voice heard. That's going to mean something different for each of us. So if you see a campaign and it doesn't resonate with you, that's okay. Use the avenues that are available to you to advocate for better precautions. Participate in those campaigns, share them, and take action in the way that you can. Maybe that means starting up something like a local mask distribution. Maybe that actually means supporting your friends and family and taking precautions. And maybe that simply means wearing a mask yourself. That is a very, very important act of caring for our community. And I thank each and every one of you who are masking in your daily lives. Thank you.
Thank you so much, Dr. Sundling. It's wonderful to have you here. We really appreciate your expertise. Again, I want to remind everyone that Dr. Sundling runs a Discord server called the COVID Precaution Community. I'm going to drop the link to that again in the chat. One wonderful thing about Discord is that, sometimes we've seen online that a Facebook group gets too many content moderation issues and Facebook makes it go away. With Discord, you never have to worry about that happening. So it's a lot more accessible, and it should be something that you never have to worry about just disappearing one day. So if you're not on Discord, it's a great place to be. Dr. Sundling's community is really a great place to meet other people who are dealing with the same things that we are. And also there's a bunch of channels about like hashtag Ask a Scientist is a great place to drop a question if you'd like someone with authority to kind of look at your question and give you an answer that isn't just some random person on Twitter answering your question. So thank you so much, Dr. Sundling. Thank you, Dr. Marjorie. Thank you, Dr. Kavanagh. Thank you, Aaron Collins, the mask nerd. We really appreciate all of our experts coming together for this forum. Thank you, Julie, for running Mask Together America. And again, if you want to get involved with us, we have Facebook, we have Instagram, we have Threads. We're Mask Together America on both of those. On X, we are Mask with Us, Julie? I'm forgetting what our handle is on Twitter. Okay.
Mask with Us is our private group on Facebook. And we encourage everyone to take a mask selfie today or tomorrow and post it on social media.
Perfect.
I'll get
right on that.
And the hashtag, you can use our hashtag, is MaskTogetherAmerica. And that will get us all coming together.
And you can always email us, MaskTogetherAmerica@gmail.com, if you're interested in getting more involved with us. We are a completely volunteer organization, so everything that we do is very grassroots. We're not very formal in that regard. Julie and I found each other on Twitter, and here I am. So that's kind of how all of us found each other. We're just social media connecting with other like-minded people. So we would love to connect with you as well. So thank you, everyone. It is now.
Oh, one last thing. We are going to try to get to DC on March 15 to support the long COVID march. And so we encourage everyone, if you can, if you live local in Maryland or Delaware, if you can make it to DC, join us. We'll be marching together to raise awareness about long COVID, to demand for change, to demand for patient care, and we need more research, and that's what we can take action together. So we encourage everyone to support the long COVID march on March 15th.
And if you want more information on that, again, you can email us. But we're going to do our best to be there and hopefully have a ton of long haulers and advocates and other friends to support bringing awareness to Washington, D.C. So it is now the top of the hour. Thank you so much for spending your evening with us, and we look forward to seeing you all soon. Thank you, everyone.